Thank you. We are currently located on the land which has long served as a site of meeting and exchange among the Mississauga peoples and is the traditional and treaty territory of the Mississaugas of Scugog Island First Nation. We honor, recognize, and respect this nation and its indigenous people as the traditional stewards of the lands and waters on which we meet today. Today, on behalf of the Regional Municipality of Durham, I'm sending my deepest sympathies to the family and friends and colleagues of Brock Township Mayor Debbie Bath Haddon. Mayor Bath Haddon was elected as mayor in 2018, becoming the first female mayor in Brock Township's history. She was first elected as the Ward 4 local councillor in 1997, a position she held for 3 consecutive terms until 2006, then served as a regional councillor from 2010 to 2014. Mayor Bath Haddon was a strong and positive force in municipal politics. She was a passionate leader who led many local community endeavors that will leave a long-lasting impact on the Township of Brock and Durham region. She will be truly missed. Councillor Smith, if you would like to say a few words, please.
Thank you, Chair Henry, and certainly the words you have expressed described Mayor Bath Haddon to a T. She was a great community person and a great advocate for the township in Brock. Some of you may be aware that her father-in-law, Don Haddon, spent 4 terms as a regional councillor and 2 terms as mayor of Brock Township. And so the legacy of the Haddon family in Brock and on the region is quite distinct. Debbie always had that great smile and a great laugh and great sense of humor, and worked tirelessly for Brock. She was a person that, while you may not have always agreed with her, you always knew where she stood. And she'll be missed. She did a great job, and we will miss her greatly. Thank you.
Thank you. Mr. Clerk, could you conduct a roll call and review the rules for today's meeting?
Anderson.
Here.
Ash.
Present.
Barton.
Present.
Carter.
Good. Good. Good morning.
Chapman.
I heard Carter in the background. He's here.
Good morning.
Collier.
Present.
Crawford.
Present.
Dyes.
Present.
Drew.
Present.
Foster.
Present.
Hyatt.
Present.
Kerr.
Present.
Leahy.
Present.
Oh, they're coming to it right now.
Good morning. Here.
Just in time.
Pietri.
Present. Good morning.
McLean.
Present.
Mitchell.
Present.
Mulcahy. Mulcahy. Not present. John Neal. John Neal is present. Joe Neal.
Present.
Joe Neal. Joe Neal. Not present. Nicholson.
Present.
Pickles.
Present.
Roy.
Good morning.
Ryan.
Can you hear me?
Present.
I see Mulcahy's joined us. Ryan.
Councillor Joe Neal's present.
Joe Neal's present. Schumer.
Here.
Smith.
Present.
Watton.
Present.
Yamada. Yamada. Not present. Chair Henry is present. Members of council, for today, we have teams available, both audio and video. We ask that you please use the video when speaking. The chat bar is open. It is to be used for request to question or request to speak only. The chair will not acknowledge any notes in the chat bar before we come upon the item. Please mute when you're not speaking, and please ensure that should we go into closed meeting, you're joining us from a secure location. Going forward, standing committee and advisory committees will be held virtually with no one in the room. There will be some exceptions made in the February F&A committee and for committee of the whole and council. Thank you, Chairman.
Thank you, Mr. Clerk. Could I get a motion to adopt the minutes of the Regional Council meeting December 16th, 4.1, please?
McLean.
So moved, Mr. Chair.
Moved by Councillor Miriam Pietri, seconded by
Councillor Lee.
Councillor Lee. On the item, I'll call the vote. All those in favor?
Yes.
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 In opposition? None, that carries. Item 4.2, Committee of the Whole meeting, January 13th. Could I get a mover, please?
Smith moved.
Carter.
Moved by Mayor Carter, seconded by
Kerr.
Councillor Kerr. Comments or questions? Call the vote. All those in favor?
Yes.
Yes.
Yes. Yes.
Yes.
In opposition? None, that carries. Members of Council, will move on to item number 5. 5.1 is Dr. Robert Kyle, Commissioner of Medical Officer of Health, talking about our COVID vaccination plan. Members of Council, I'm going to ask, normally we would go to Dr. Kyle under other business, but if you have any questions for Dr. Kyle today, if we could do it now. I know that he's got a number of things that he has to move on to later in the day. So, Dr. Kyle, are you on the line?
Good morning, Chair. Can you hear me?
Yes, we can hear you, and when you're ready, please start.
So good morning, Chair and members of Council. Before I dig into my deck, again, I'd like to shout out to my entire team for their tireless efforts in responding to the pandemic and our regional partners who've been with us every step of the way. I'm sad to report as well that I've just been informed that the spouse of one of our staff has succumbed to COVID-19, and our thoughts and prayers are with our staff person and her family in this time of grief. Could I move to the first slide, please? So I've been asked to talk about the state of vaccination planning in Durham Region. I will move quickly through my deck, and then of course I am happy to entertain any questions. And I apologize if some of this is old news to members of Council. As you know, there are 2 vaccines that are currently available and approved by Health Canada. In Durham, we have the Pfizer-BioNTech vaccine. There is also a Moderna vaccine. There are a couple of additional candidate vaccines that Canada has made arrangements with the manufacturers with, but they are under review and, of course, would be subject to regulatory approval. Next slide, please. You should have seen this slide before. This is an earlier slide which is meant to depict Ontario's COVID-19 vaccination program. I don't think the details are that important. I think what members of Council need to understand is that there are 3 phases to the distribution plan. The phases depend on the availability of the vaccine coupled with capacity within, in our case, Durham Region, to vaccinate populations. And there are targeted populations, and the populations to be targeted span the first and 2 phases before we get to, if you will, mass vaccination. If you move to the 3rd slide, This is a very busy slide. It's meant to depict the previous slide in more detail. Again, I don't think the details are as important as the concepts. So if you look at the columns, there are the 3 phases of the distribution plan. And if you look at the rows, you'll note that there are targeted populations, there are expected doses, and as you probably are aware, this week, for example, we're not seeing the Pfizer-BioNTech products, so they're estimates. And in terms of vaccination sites and priority populations, I think the key thing here is we're looking at hospital sites, we're looking at on-site clinics. I'll get into that in a moment. And then we're looking at community-based sites. And again, we're looking at targeted populations as the vaccine becomes available. Next slide, please. So in terms of vaccination planning, there is a community vaccination set of tables that exist. There is a vaccine planning executive table populated by public health, acute care, primary care. This is at the executive medical leadership level, and this is meant to act as a table to provide overall coordination and to ensure that there is communications, coordination, and collaboration happening among the various sectors. There is a steering table which is made up of representatives from acute care, primary care, and public health. And it is overseeing really the nuts and bolts of Durham's immunization plan. It has struck a number of working groups that are focusing on vaccine distribution, administration, logistics, and communications. The steering table has signed off on a draft Durham Region immunization plan, which has been submitted to the Ministry of Health for review. We are expecting feedback from the province, and the goal is to have the plan approved as soon as possible and possibly as soon as the end of the month. Next slide. Backing up the community-based planning is an internal COVID mass immunization task force. It is focusing, among other things, on the operationalization of mass vaccination clinics. You can see the list of the members making up the task force. It's led by Public Health and Durham Emergency Management. And it has been working flat out to get on top of mass immunization in Durham Region. And its accountability is through me to the Regional Control Group and to Health and Social Services Committee and Council as required. Next slide. To give you some numbers, this is a somewhat dated set of data, but the target population depends on the vaccine. For Pfizer, I believe it's over 16 years of age, and for Moderna, it's over 18 years of age. And if you focus on, first of all, the first table, in terms of numbers, you're looking at quite a large population. And to put those numbers into some perspective, and you need to bear in mind, of course, that not all of those numbers will be vaccinated. This is voluntary vaccination. And of course, depending on the vaccine, you may need to double the number because, of course, at least the existing products require 2 doses. But to put the numbers into some perspective so that you understand the magnitude of the operations we're talking about, we were the main vaccine delivery agent for pandemic influenza, if you can remember back. And at our community-based clinics, I think we reached, and I'm going by memory, about 165,000 Durham residents. So we're certainly looking at a scale much larger than that. The settings table just is meant to depict in numbers the, if you will, fixed sites that we could rely on for on-site clinics. And I think the key point here is that if you look at the main on-site potential clinic sites in Durham region, most are primary care offices. That's what's meant by vaccine storage and handling sites, and the other are pharmacies. Next slide. So just to summarize, we're in phase 1 right now. What you need to know is a bit of a pause has been put on the original phase-in of vaccination. Because of the shortage of Pfizer vaccine product, earlier this week, a decision was made for the remaining supplies of vaccine to, first of all, go into the arms of residents of long-term care homes and high-priority retirement homes. I understand that has happened in Durham region. To shift Moderna vaccine, which we don't have, from those areas that have adequate supplies to at least, I think, 14 public health unit region areas that don't have any vaccine, so that they can start vaccinating residents of long-term care homes and high priority retirement homes. The remainder of the vaccine will then be focused on second doses of long-term care home and retirement home residents, high priority retirement home residents, and then healthcare workers who have already received their first dose. So that's where we're at right now in terms of phase 1. Next slide. So the go-to website that we will be using to, and are currently using to provide the public with information about COVID-19s is this website, durham.ca/COVID vaccines. And it will be a prime tool that we will use to communicate to the public about availability of vaccines, clinics, and the like. So that's the platform that we intend to use. And this, of course, would be amplified by messages on our various social media and other channels and platforms. Next slide. So finally, just a list of useful website links to get information about COVID-19. And with that, Chair, I'll turn it back over to you to handle any questions committee members or council members may have. Thank you.
So thank you, Dr. Kyle, and thank you to your team. Remember, members of council, I've asked that if you have any questions for Dr. Kyle, it would be the appropriate time to go into the chat box. First questions come from Mayor Foster.
Mr. Chair, thank you. Dr. Kyle, thank you. And please thank your staff and for the engagement with the community. It is really important. Doctor, we're reading that some of the healthcare workers, particularly in long-term care facilities, because of the hours when vaccinations are made available, that they simply can't get them. To your mind, are we doing everything that we can to ensure that those workers have easy access to the vaccine?
Let me answer it this way. The initial rollout of the Pfizer vaccine for storage and handling reasons had to be done at Lakeridge Health Oshawa at a hospital-based vaccination clinic. I would acknowledge that its hours may not have worked for some long-term care home and retirement home workers. I'm not familiar with employment practices in the various long-term care homes and retirement homes. I understand that we, for example, did make time available and tried to work on accessibility for our own employers and employees, point one. Point two, since early January, we have been in the homes vaccinating with first doses residents, and my understanding is healthcare workers, essential caregivers in those homes. So again, will you capture all employees? I don't know, but I do think between ourselves and employers, we've done our best to try and make the vaccination as accessible as possible. Is it perfect? No. Is there room for improvement? Always yes, but we've done our best.
Mayor Foster? Okay. Mayor Foster, you're on mute. Okay, we'll come back to Mayor Foster. I'm not sure that he's not.
He may be having difficulties, Mr. Chair. I see on the chat box that it says he's left the conversation.
Okay, thank you. We'll come back to Mayor Foster. Councillor Schumer.
Thank you, Mr. Chair, and through you, thank you for the update, Dr. Kyle. I just got a question regarding, a couple of questions maybe, regarding the rollout eventually to pharmacies and primary care. Who is it that is doing that negotiation? Is that the province or the local health departments that are arranging with the individual pharmacies to do this?
Yeah, so it's early days. My expectation would be that one of our working groups that is working on the vaccine administration would be doing that work. I'm not aware that the province is dealing directly with pharmacies. That may be happening. Of course, as you know, government works directly with pharmacies with respect to flu vaccine. But as of today, it's my understanding that we would have those discussions locally with the pharmacy. Again, it's early days. We don't have a lot of vaccine. So, you know, there is work to be done in terms of reaching out and engaging local pharmacies.
Thank you. The reason I ask is, of course, Brock does not have a hospital in it. So I would imagine when that rollout phase begins, I guess phase 3, it's going to be some of the pharmacies in our areas. And of course, they're all relatively, you know, small or private pharmacies. And possibly, I guess, maybe the Brock Community Health Center. But it, just to confirm, it looks like at this point that it will be your department that, or the working group that will be ahead of time arranging for those locations to roll out the vaccine. And I take it will, as we get to that phase, we'll be getting an update on that status of those negotiations.
I expect council is very interested in how the planning is unfolding. And what I would say is that we plan to conceptually rely on hospitals, pharmacies, family physicians' offices, so fixed sites, if you will, coupled with mobile clinics to reach, you know, hard to reach populations, supplemented by mass immunization clinics. And I'm not personally involved in the location of of sites, but it's my understanding that we're targeting all 8 area municipalities. So that, Brock Township would be part of that as well.
Thank you. I look forward to the information coming down and is getting to phase 3 as soon as possible. Thank you.
Mayor Foster, you're back on the line. Do you have additional questions for Dr. Kyle? Mayor Foster? Okay, we'll move on to the next member of council, Councillor Anderson.
Thank you, Chair. Thank you, Dr. Kyle, for the update. It has been well documented through various media outlets that non-frontline workers in other jurisdictions are getting vaccinated ahead of frontline workers and vulnerable seniors. What do we have in place to prevent that from happening in Durham?
So let me answer it this way, Councillor. Until there was approval to transport Pfizer vaccine off-site, the focus for vaccination was on high-priority healthcare workers, including those in long-term care homes and high-priority retirement homes, as organized by Lake Ridge Health. The day after authority to transport the vaccine off-site happened, we were in the long-term care homes. So as I may have indicated, all residents, or at least as many as possible residents in long-term care homes and high-priority retirement homes have received their first dose. As I tried to indicate, the priority for remaining supplies of vaccine over the next few weeks ahead is to ensure that all these residents receive their second dose. For those who have received their first dose, healthcare workers, for example, they're to receive their second dose, and then we can move on to those essential workers, for example, who have not received a first dose. This is a direction by the province. I expect that all of us are adhering to the direction from the province. If there have been, sort of past transgressions of the current direction, I can't speak to that. But I do know in Durham region, our focus is on those at highest risk for disease and death from COVID-19, the residents of our long-term care homes and high priority retirement homes. And that has been our focus, and that will continue to be our focus.
Thank you. I am happy to hear that's our focus. One other question through the chair. Like in the community, I've heard folks are saying, why can't businesses open up, et cetera, et cetera. Most of the deaths are occurring in long-term care homes and retirement homes. The problem with that is I don't agree with that. It's kind of disparaging to folks in homes as far as I'm concerned. So my question is, there are well-documented evidence that although folks might not pass away from COVID-19, there are lingering after effects, like I've read where folks have memory loss, they cannot go back to work, etc. And we don't know the long-term implications of folks who have suffered from COVID maybe 6 months from now, a couple of years from now. Could you elaborate on that and just emphasize the importance of trying to be safe and trying to follow all the guidelines in order not to get COVID, although you might not actually die from it, but there are consequences down the road? Could you just talk about that a little bit, please?
So, Councillor, let me answer it in two ways. With respect to what we call in the business adverse events following immunization. We are on the receiving end of reports of adverse events from vaccinator sources. We provide that information through our digital platforms to the province. And Public Health Ontario is now publishing a weekly summary of adverse events following immunization. My understanding is that to date, there have been no serious side effects, but we are now receiving such reports, and there is weekly reporting of what's being reported centrally. So those who are skeptical, those who want more information can go to the Public Health Ontario website. On the issue of remaining vigilant, we still have to remain vigilant. We still have in the order of high double-digit new cases every day. We continue to have in the order of 40 to 50 outbreaks on a daily basis. Of course, we continue to see the toll, and I don't want to overemphasize this, the toll it's placing on our acute care systems, but we have significant numbers of hospitalizations. Some of those cases require ventilators or ICU admissions. And for the healthcare system as a whole, there are areas of the province where they're very stressed hospitals, and in fact, patients are being transported from high volume to low volume hospitals as we speak. The only way we're going to get through this, particularly as we have to wait for vaccination to take hold, is vigilance with respect to public health measures. We all have a role to play, and it's all about preserving scarce acute care resources as much as it is, for example, those who are younger, seeding, if you will, COVID-19 in settings where there are vulnerable populations. And the last thing I would say, Councillor, is you're probably hearing in the news about so-called variants of concern. Why these are of concern is, of course, that they have different characteristics, including increased transmissibility. And I don't think I need to go any further than to remind you of the outbreaks occurring in Simcoe County, in Barrie and Bradford, to reinforce the importance of us to continue to be vigilant with respect to public health measures.
Thank you very much. Thank you, Chair.
Thank you. Mayor Foster, I understand you're back on the line. Did you have additional questions for Dr. Kyle?
I do, thank you. My apologies. The hardwired system is down and Wi-Fi is working, go figure. So Dr. Kyle, I heard most of the answer on doing our best to provide for our healthcare workers. This isn't a new concern. Do we have expectations of staff? So there will be staff that either will not or can't be bothered to get a vaccination. Are we looking at that? So for folks who can't be bothered or will not get the vaccination, are we ensuring that they're not dealing with vulnerable populations?
The short answer is no. If you're a healthcare worker who chooses not to be vaccinated, you still have to adhere to all the rules in your healthcare setting, including wearing protective personal equipment, undergoing screening, et cetera, et cetera. There is no way that we can force people to be vaccinated against their will. But I think centrally and locally, what we can do is educate the public with respect to the safety of the vaccine, the benefit of the vaccine, perhaps do some myth busting if there's out there, and do our best to deal with what we call in the business vaccine hesitancy. But a healthcare worker is expected to provide the best care possible for their patients or clients, and to do so adhering to the appropriate and applicable public health measures.
Thank you, Doctor. That's maybe a discussion that we need to have another day. It's beyond this, but I'm not sure if, for example, a surgeon that refused to wash his or her hands should be a surgeon. But anyway, discussion. I know that you have a number of frustrations, and some frustrations should be articulated publicly, some shouldn't. Is there a role for Durham Region Council to help you on some of the frustrations that you can articulate around this? Are we doing all for you that we need to be doing?
Let me answer it this way. I think the support we've had from regional partners, I know you're asking about council, but the support we've had from regional partners up to now has been outstanding. I expect you, as my Board of Health, to hold me accountable for the pandemic response, including vaccination. I look forward to these encounters where I can provide you status information and answer your questions. So I would continue to provide excellent oversight as you have up to now. And if there is a need, for example, for there to be advocacy, then I'm not too shy about requesting that through council. So I think that's the best I can do with that one.
Okay, thank you. And lastly, I have actually had two, I know this is not a landslide of requests, but two requests asking that morticians be included in those getting vaccinations first, which does not seem unreasonable. If it's not unreasonable, can you pass that along, or is there an effective way that we can pass that bit of advice along?
Councillor, I can tell you that we've received similar requests from a wide variety of groups that consider themselves essential, but perhaps haven't made the list, if you will. We're guided by an ethical framework when it comes to allocation of vaccines. We're guided by provincial direction. But I will certainly take this request back to my team and look for an appropriate channel to pass on that request.
Wonderful. Thank you, Doctor. Thank you, Mr. Chair.
Councillor Kerr.
Thank you, Mr. Chair, and good morning, and through you to Dr. Kyle. And first of all, Dr. Kyle, I would like to give you a sincere thank you and your staff for your quick responses to any inquiries I have, both for myself on behalf of the residents. And I'd also like to say I very much come to appreciate your meticulousness in dealing with the slides, but also in your responses. So thank you very much for that. I'm very gratified to hear that the plan for long-term care and frontline workers is moving ahead, and having a 92-year-old mother-in-law who's healthy living across the parking lot from a long-term care home, I appreciate keeping her healthy too, and she has had her shot. My questions are slightly wider in scope, and the first one, I guess, is currently we're in an enhanced, what I might call an enhanced gray lockdown period, and I'm wondering, I'm seeing Durham's numbers dropping nicely. Is there a point at which we can say that we are now gone from gray to red, and perhaps from red to orange? What can residents know that would they could anticipate some alleviating of the lockdown?
So, Councillor, thanks for the question. What I would say is being in shutdown versus reverting to the previous response framework that places PHU regions into different colors is a provincial call informed by the CMOH and a decision taken by cabinet. I am encouraged by our numbers. Not only are our numbers in the, I guess, high tens as opposed to the low 100s, and not only is our weekly average number of cases per 100,000 sitting around 70, our positivity rates have gone down, our RT number has gone down. So I think it's fair to say where we're sitting right now is at metrics that are similar when we were in red control. Having said that, we don't have students back in school. And of course, I think the province is all over variants of concern, which is changing the landscape. So it's a provincial call as to whether or not we revert back to response framework. I think it keeps a very close eye. I know it keeps a very close eye on our metrics. I suspect that in the probably weeks ahead, not the days ahead, the COVID-19 science table will update its projections to see whether or not the shutdown had its desired effect. But we need to be realistic. We need to realize that certain parts of the province, acute care is still very stretched. We need to understand that I think the estimations of vaccine delivery have been less robust than was hoped. And so we're still in the thick of the second wave. But personally, I'm pleased with our numbers. It seems like the shutdown has had an effect, and/or the numbers we saw at the beginning of the year were related to activity related to the holiday season. So my advice would be stay tuned and stay patient and remain vigilant.
Okay, well, a follow-up to that. There's a little bit of confusion that I've come across. Recently, I saw a number that perhaps the lockdown's been extended to February the 9th. Earlier, I thought it said February the 19th. Between those two dates, we have Valentine's Day and the family holiday on the Monday. Is there some thought to the actual lockdown being the 19th to get us past those two typically social gathering type times? Or in fact, are we still looking at February the 9th?
Let me answer it this way, Councillor. I think the date that was set in February was based on the required number of weeks it takes to take stock to see whether or not the shutdown 2.0 measures had an effect. And it's you usually look at a 2 to 4 week period. I'm not aware that the family holiday and Valentine's Day were part of that calculation, and I don't have the facts and figures in front of me to get into. Is it the 4th, the 11th, the 19th? My recollection, if I'm correct, in a date in February, is that the return to school to elementary students in the high priority PHU regions is extended to February 11th. That's the only date that sticks in my mind.
Okay, thank you. And through you, Mr. Chair, my last question is, on the slide, it mentioned the broader sector vaccinations being available in August 2021. I don't expect you to have a crystal ball, but in terms of between now and then, how does that play forward for potential lockdowns or moving to less intense colors, if we can put it that way? And what does that say about the timing to get everybody vaccinated after, and what that might mean to our economy in terms of opening up businesses? So I realize that's a pretty complicated question in many stages, but can you give me your best forward guess or projection on that, please?
So, Councillor, let me answer it this way. Is it likely that the shutdown will revert back to the previous response framework, say, between now and June? I'd be very shocked if that was not the case. Was the or has the vaccination plan been crafted with, if you will, the seasonality of COVID-19, the expected framework that we've been using, and an expectation that the economy would have picked up, say, by the summer? I can't answer that. I think the main drivers of the vaccination plan stages was really availability of vaccine coupled with our ability, to mobilize the various clinics and sites and strategies to get the vaccine out. I'm not sure that the response framework shutdown and so forth was part of that calculus, but I don't sit at those tables, so I don't know.
Okay, and I guess finally then, once that broad sector vaccination process begins, projected to be August, is there an idea of how long that process will take and to restore that higher level of confidence in the broader community?
Thanks for the question. What I would say is I think there is an expectation by government that that the vaccines that are received by them make it into the arms of Canadians, as many as possible, by the end of September. That's the aspirational goals, if you will, that I've heard. And I think end of September is, of course, there's a seasonality to these respiratory infections. So I think the hope would be that most Canadians would be vaccinated to protect them should there be a rise in COVID-19 in the fall. I think it's the expectation of governments that at least your clinics would be operating 7 days a week. I don't know how many hours per day, but I think it's the expectation that we would work flat out in phase 3 to get the vaccine out as quickly and effectively and as efficiently as possible, bearing in mind that the aspirational goal is the end of September. So I think that's the best that I can say.
Well, thank you very much, Dr. Kyle, and thank you, Mr. Chair, for the opportunity to question.
Thank you, Councillor Pickles.
Thank you, Mr. Chair, and thank you, Dr. Kyle, for your good work, the good work of our staff, and for always answering questions timely when I send you an email or your staff. From your previous update to us, I think there's been some progress, it sounds like, in the rollout or the action plan for vaccinations. I seem to recall last time we were waiting for provincial direction or plans with respect to vaccinations. And now I see that we have put together a vaccination plan, shared with the province for their comments. So have things progressed that it's kind of a two-way discussion now with our public health having a greater role in helping to develop that plan than we did a little while ago?
Councillor, let me answer it this way. So we, public health, have led the development of the tables that I talked about, both the executive table and the steering committee table from a community planning perspective. We have also led, in partnership with DEM, the development of the internal immunization task force, and a government turned to PHUs to provide them with the immunization plans that you just referenced. So clearly at the tables that I sit at, there's an expectation that there is a shifting that has been happening with respect to, if you will, ownership of vaccine administration from hospitals to public health. So in that sense, I think progress has been made.
I think that's really important to note, and you and I had discussed that we were concerned that the public health units weren't in the provincial plan as much as they should be. So I think that's a really great development that I'm very happy to hear about. When we talk about essential workers getting vaccinations ahead of the general population, and I know we've talked about a couple groups of essential workers. I'm sure we haven't forgotten, and I would like your input. Those businesses that are deemed essential and that are open, if you're a cashier at a grocery store, or if you're one of our bus drivers, and everybody's being very careful and having protocols in place, but these people are seeing or interacting with hundreds of people a day, if you think of a cashier. So as part of our plans, in addition to healthcare workers, are we thinking about those businesses that are open, like grocery stores, bus drivers, and morticians were mentioned earlier, and probably a number of others? Are we thinking of them so that they're going to be vaccinated in the stage 2 and certainly ahead of stage 3, because they're seeing a lot more people on a daily basis than the general population who are staying at home?
So let me answer it two ways. The first is our main focus right now is on residents of long-term care homes, retirement homes. But because that took time to get the necessary, if you will, approvals to transport Pfizer vaccine out into the community, there were hospital-based clinics which focused on high-priority healthcare workers, hospital workers in particular, and long-term care home and retirement home workers. Once you get beyond those settings and those workers, when it comes to who else is essential, the only guidance we have is the ethical framework that I mentioned, and provincial direction where particular classifications of workers have been identified. If you're asking me, when we get to either late phase 2 or phase 3, will we be targeting specific professions and or encouraging specific professions to get their vaccine earlier than others? I don't think we're there yet. I think you make a valid point. And we've heard lots of suggestions with respect to who should be considered essential. I suspect that for the workers that you described and many others who would consider themselves to be essential, we may have to, by default, rely on the mass immunization clinics rather than targeted, say, mobile clinics, because at the end of the day, the disease and death is adversely affecting both the elderly and hard to reach vulnerable populations. So I think that will be the focus going forward with respect to targeted mobile clinics, for example. So I know I'm being a bit evasive, but we're really not there yet. But I do think I do take your point, and I'm sure that that will be a very live issue going forward.
Well, I know it makes individuals like myself who, you go to the grocery store on any given week, and that cashier has probably seen 250 people before you. But I'll leave that in your capable hands. My final question was just about the mass vaccination. I guess it's more of a phase 3 thing. So it sounds like by the time we get to phase 3, that individuals may have available to them either to go, say, to a hospital, to their own physician, to a pharmacy, and also it seems that we're looking at the possibility of mass vaccination sites. So municipalities could identify a closed recreation center or a vacant rink or some other public building where many people may come to get vaccinated at a clinic, say. And I think you mentioned they may be mobile, so maybe they would move around. But do you think by the time we get to phase 3 that there will be that list of options available?
So thank you for your question. I think that of what you've suggested, at least 2 or 3 options may be open. The first would be either primary care and or pharmacy sites. The second would be mass immunization clinics. I'm not sure that hospitals will play a prominent role beyond their own patients, beyond their own workers. And I think mobile clinics will be focused on hard-to-reach populations, sort of special populations where, for whatever reason, either getting to a physician's clinic or a mass immunization clinic is not feasible or practical. And so, I'm thinking of seniors in congregate living centers, that sort of thing. But I do think that there will be some choice in terms of mass versus, your own primary care provider, for example.
Okay, well, thank you very much, and keep up the good work.
Councillor Joe Neal.
Through you, Mr. Chair. To Dr. Kyle, the schools in Clarington are still shut down, although the schools in Peterborough are now open, and Clarington's actually part of that same board, the Peterborough Victoria Northumberland board. So do you think that makes sense given the, I think, relatively low number of cases in Clarington, to not have the schools in Clarington open?
Councillor, what I would say is I think the province looks at a PHU region as a whole. So they don't look just at Clarington, but they look at Durham region as a whole. I expect that the province will be making a determination as to whether other PHU regions should allow elementary students to return to school. I haven't had any discussions with his office, but my understanding is that determination is made on a weekly basis. So it makes sense to me to treat Clarington schools as the same as other schools in Durham region, and we will see what the province has to say in terms of our health unit later this week. That's about the best I can say with that question.
So there's a couple follow-ups to that, though. Like, again, this may not be your particular bailiwick, but there's students that, because of internet issues, don't have access. Very good access to online learning, so they're falling behind, and I think there's sort of a burgeoning mental health issue with students being kept out of school. And any comments on that? Like, in other words, I think a lot of young students, students that should be attending elementary and high schools, I think they're encountering a lot of mental health issues because of what's going on. And
yeah, so what I would say is I'm aware of those discussions at some of the tables that I sit at. I'm sure that the Ministry of Education is attuned to that and as anxious as anyone for students to return to the classroom if that is safe, and to deal with some of the issues that you've talked about. But beyond those sort of general comments, I really don't sit at those tables where those determinations are being made. I expect that there will be announcement in the next few days, but what impact, if any, there is on Durham Region, I just don't know.
To the chair, what's the infection rate in Clarington right now? Do you know? Or?
I don't have the data tracker in front of me. Yeah, I don't have it in front of me.
Okay, thank you.
Councillor Nicholson.
Thank you, Mr. Chairman. I just have a couple of questions. One a simple one and the other one a little more complicated. My first one is I've received a number of inquiries from residents who are wondering if there's any consideration being given to set up an online registration form for people that desire to have a vaccination would be able to come in and fill out and outline any of their special health issues that they maybe wish to provide to those deciding on the rollout of the vaccine.
I'm not aware of any discussions happening in that regard at this point in time.
Is that something that would make some sense moving forward to try to help organize the, I guess, the queue we're looking at to get people vaccinated?
So, Councillor, I can take that idea back. I really don't know if it's feasible or practical. I just don't know.
All right, thank you. My second question deals with the answer you gave to an earlier question. I'm personally a little concerned that people in the health or public fields that are in contact with the public have the opportunity to refuse vaccination. I'm looking at healthcare workers in our seniors facilities, long-term homes, other health departments' homes. If they're allowed to not have the vaccine at their discretion, are steps being taken to have them reassigned to areas where they're not going to present a risk to others, either in their facility or to the public in general?
So the short answer is I don't believe so. As I said previously, whether you're vaccinated or unvaccinated, you're expected to adhere to all the public health measures that apply to your facility, including screening, wearing PPE, etc. And I'm not aware that there's any central direction to reassign folks from certain lines of work to other lines of work. And I suspect that, yeah, I'm not aware that that's happening.
Okay, but as a medical officer, isn't it your responsibility to ensure that when someone's providing medical services into a long-term home, is providing support, that they are not a risk or even a potential risk to those that are providing services to? I think the argument was made previously, if I was going in for surgery, I wouldn't allow my doctor or a nurse not to wash their hands or wear the appropriate equipment. So when there's an opportunity for a vaccine to be available, should that not be a management discretion as to whether you work with the public or you work with those that are potentially higher risk and not an individual mandate?
Councillor, all I can say is I don't have a role, say, in terms of that particular issue, say, in a hospital setting. To the extent that we deal with this more generally, it's to get at myths, to promote vaccine, to reward good behavior, if you will. So we have, for example, an annual flu event, and we recognize those long-term care homes, for example, that have high staff vaccination rates, but it really is up to the particular hospital, long-term care home, other setting to deal with those issues, and I have no role to play.
Is this something that could be addressed at the other levels of government or the general meetings held between the various medical officers of health to look at a mechanism to provide the authority to restrict those who refuse vaccination from access to the public, because they do increase the risk to the public?
Councillor, I'm not sure that there are any powers that I can use to deal with this. This is a fundamental, choosing not to be vaccinated is not only a fundamental human rights issue, but arguably it's a charter issue as well. To the extent we talk about this, we describe it as vaccine hesitancy, and how we try to tackle that issue is to be open and transparent with respect to risks and benefits of vaccine, to do myth busting, and to role model. But beyond that, I'm not sure that's the role for us to play, and I do think it's up to employers and their employees, and for certain professions that are regulated, for the regulatory colleges to deal with these situations.
I'm sorry, I don't want to press you on this, and please, you're the only person we can talk to on this. So I guess my concern is many residents are concerned that if they go into a facility and staff have refused vaccines, that they're putting themselves at risk. And especially in areas where there's heavy public interaction with the workers in the facility, you were able to shut down businesses in order to protect those from expanding the infection rate in our community. But now as we move forward to the vaccination, we could end up having businesses still being impacted because their employees are refusing the vaccination and are not following the appropriate orders. So I guess the point I'm putting to you is that I think a lot more thought has to be given, both with all the medical officers of health and also with the provincial authorities, because I think people need to be assured that when they enter a healthcare facility especially, that all persons that they are in public contact with have been appropriately vaccinated when it's made available to them. And if someone makes the charter choice to not being vaccinated, that they be reassigned to an area where they're not going to be in contact with the public on an ongoing basis. I would just ask you to consider that in your next meetings with your colleagues. Thank you.
Councillor John Neal.
Yeah, thanks, Mr. Chair. To Dr. Kyle, and I'm going to touch on a little bit of what Councillor Joe Neal mentioned in the schools. It's being advertised on the media that one in three children are going to school hungry. So I can't imagine what's going on with this pandemic. I did mention the mental part of it for seniors back in August. I made a comment there to one of Dr. Kyle's previous presentations, but I don't know if this reflects back, Mr. Chairman, to our social services, to Stella, or who could address this. Like 1 in 3 children supposedly were getting hunger addressed when they were attending school. So how is this affecting the adolescents and children of Durham region? I guess that's my question in regards to hunger with this pandemic.
So, Councillor, let me answer it this way. I think the Ministry of Education is quite aware of the, I'm going to say, downsides of there not being on-site, in-person education. And I'm pretty sure that other things being equal, the Ministry of Education would love students to be back in school And of course, the school is an excellent setting for a variety of different programs and services from the health department, and including school nutrition. Having said that, we do have a pandemic. I know that the Office of the CMOH provides ongoing advice to the Ministry of Education. I think the reason that return to school has been delayed is because of the community transmission that's going on, which is now being complicated by these so-called variants of concern. I know that the Office of the CMOH is looking at the metrics on a PHU by PHU basis. And when his office believes that it's safe for kids to return to school, then he will provide that advice to the Ministry of Education and others. And Cabinet will make a decision as to whether or not it's safe to return to school. And I'm sure that the adverse effects of being out of school, including school nutrition, is certainly a consideration.
Councillor?
Yeah, thanks, Doctor. Thanks, Mr. Chair.
Okay, thank you. Members of council, that exhausts all the questions in the chat box. Dr. Kyle, I want to thank you for being here this morning and for the work that you and your team and DEMO does to make sure that the residents of Durham are safe. So thank you very much.
Thanks, Chair.
Members of council, I'm going to ask that we go to Committee of the Whole report, item number 2, report to number 2021-COW2. Could I get a motion to alter the agenda to bring that item forward? There is there is a need to have it finished because it has to go out by the end of the day. So moved on altering the agenda, moved by Councillor Crawford, seconded by
Leahy.
Councillor Leahy. This will take 2/3, so I will call the vote now. All those in favor?
Yes.
Aye.
Yes.
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 In opposition? Hearing none, Mr. Clerk, that gives us our 2/3. Members of council, if you could turn to page 62 in your agenda, item number 2. Could I get a mover and a seconder on this report, please?
Move it, Mulcahy.
Moved by Councillor Mulcahy. Seconded
Lee.
by? Pardon? Seconded by?
Councillor Lee.
Councillor Lee. The item is now on the floor. Comments or questions to the report? Seeing none in the chat box and hearing none, I will call the vote on the report. All those in favor?
Yes.
Aye.
Yes.
Aye.
Yes.
In opposition?
Yes.
Oh, sorry. In opposition? Hearing none, item 2, Mr. Clerk, carries. Thank you, members of council. If we could go back now to presentations. Sorry, just give me 1 second. Okay, we'll now go back to presentations 5.2. Mr. Nello, Director of Waste Management Services, and Christine Rorke, HDR Consultant, Long-Term Waste Management Plan. Mr. Nello, are you on the line?
Yes, good morning, Mr. Chair. Can you hear me?
Yes, we can hear you, and when you're ready, please start.
Thank you very much, Mr. Chair. Today, I'd like to give you an update on the long-term waste management plan development. This is a 2-year program. So we had just finished the first year of consultation, and we have a report for you in the works portion where we're looking for consideration for your endorsement approval of the revised guiding principles, the vision, and the objectives. And just a quick note, the revised guiding principles were amended at Works to include a rethink in the first principle. So our consultant, Christine Warwick, helped us with the consultation, and she will be giving the first part of the presentation. Christine?
Yes, hello. Can you hear me?
Yes.
Great, thank you. Thank you, Joe. Good morning, everybody. Could I have the next slide, please? I'm very pleased to be able to present the results of our phase 1 work to develop the waste plan, and I'm looking forward to actually getting started on drafting the plan in the next stage of this process. So we started the project about a year ago. We started planning our consultation program, and then as you all know, COVID hit, so we had to pivot to virtual consultation activities. So in the spring and summer of 2020, we held a number of virtual meetings with regional staff, with local area municipalities, regional advisory committees, and with the public. So we did a variety of workshops. We held a virtual open house with a survey and a town hall meeting where the public could ask questions in real time. And we asked stakeholders to provide feedback on the current and future challenges for the waste plan, the vision and objectives that should be included within the waste plan, and input on various aspects of the future plan. We had just over 2,000 surveys completed as part of the survey that we issued. So we've taken that feedback and we've revised the vision, the guiding principles, and the objectives slightly that we're presenting to you today. We'll take this input and we'll use that to develop the plan. That's in the first quarter. That's what we'll be doing. And we'll be going back out for consultation in the spring and summer of 2021. We had hoped that we'd be able to do that in person, but it's looking like we'll have to do another series of virtual consultation activities. We'll be back in the fall of 2021 with a draft of the waste plan and a 5-year action plan. And then in 2022, we'll be presenting that to approval, and then the region will start implementing the waste plan and starting their public education campaign. Could I have the next slide, please? So this is sort of a general summary of the themes that we heard as part of the consultation program. So really strong support for more promotion education, strong themes of reduction, reuse, and increased diversion. And there are lots of comments about, can we use policies and bylaws? Can we increase diversion in multi-residential buildings? And can we also do more research and development of new technologies and best practices, which is really interesting considering that would reinforce the region's position and reputation as a municipal leader in adopting new technologies and practices. Next slide, please. So as part of the consultation process, we asked for feedback on the proposed guiding principles, vision, and objectives, and we've made some modifications based on what we've heard from the consultation process and from the recent committee meeting. So we've considered the feedback from the local area municipalities, from the regional advisory committees, and the public, including over the 2,000 surveys that were received. And there was strong support for what was proposed, as you can see from this slide. So really strong support for the guiding principles that were proposed, the draft vision, and the objectives. Next slide, please. So for the guiding principles, on the last slide, over 70% of the survey responded supporting these guiding principles and didn't have any additional comment, but we took another look at those guiding principles. Overall, we simplified the wording of them to make them easier to understand, and we added a new guiding principle, and that's listed as number 1 here on this slide. So we've incorporated the concepts of reduction and reuse. We've moved it to the top of the list to reflect the waste hierarchy, and we've included the word rethink to be consistent with the new objective, and that was based on input from the recent committee meeting as well. Next slide, please. And in terms of the recommended vision, again, over 94% of the survey respondents supported the proposed vision. Based on the feedback that we received, we did simplify the wording a little bit to make it more easier to understand. We included the concept of waste reduction, and we added some wording to make it a little bit more collaborative. So both residents and the region need to work together to make this program a success. Next slide, please. So in terms of the recommended objectives, over 89% of the survey respondents supported the proposed objectives. However, again, we did take another look at them. We added another objective to reflect the priorities of waste reduction and reuse, and also to engage residents in behavior change, because that's really important for those concepts of reduction and reuse. And we also added the word rethink as one of the 5 R's. We've also modified the second objectives. That's the one in sort of the yellow. Based on the feedback that we received, residents thought it was going to be a reduction in service, where really we meant it was going to be reducing the quantity of waste that we had to be managed. Next slide, please. So this slide shows the overall development of the long-term waste management plan. So using these guiding principles, vision, and objectives, we'll be developing the draft waste plan and developing targets and actions. We'll be consulting on the draft waste plan and incorporating the feedback into the plan. And the 5-year action plan is going to identify with concrete actions what the region's going to work on. So at the end of the 5 years, the region's going to need to undertake a review of the waste plan. Most of these waste management plans are living documents. So the region will need to revisit those guiding principles, the vision and objectives, to see if they need to be adjusted and see if they need to set new targets and actions for the next 5 years. There's going to be a lot of challenges and opportunities, including changes to legislation in the next few years. So there's going to be lots of changes, and I expect that the next 5 years after this will also be reflecting those changes. Next slide, please. So the development of this plan is taking place in 2 phases. So phase 1 is the development of those guiding principles, vision, and objectives that are pending your approval. And then in phase 2, we're going to be developing the waste plan and then going out for consultation. So we just wanted to give you a couple examples of the potential targets and actions that could be part of the waste plan. So one of the targets could be increasing organics diversion as part of the mixed waste pre-sort and anaerobic digestion facility. And an action for that could be the relaunch of the green bin program. Another target could be supporting the federal phase out of single-use plastics, supported by actions of phasing out single-use plastics in municipal facilities. Another one could be supporting the provincial transition of the Blue Box program with a targeted promotion educational campaign. So there's going to be lots of targets and actions that will be part of the plan development. Next slide, please. So I've touched on this already. So basically, after council approval, we will be drafting the waste plan and going out in late spring, early summer for consultation on that. Taking into consideration any feedback that we've received and presenting a draft plan for approval in the fall 2021, 2022. I'm going to turn it back over to you, Mr. Anello.
So as our next steps, we are looking for your approval. So there is a report in the Works Committee portion of the meeting today that asks for your consideration for the endorsement and approval of the guiding principles, the visions, and the objectives. After that, we will begin drafting the waste plan and then the second part of consultation in 2021. We will be coming back to committee and council with a draft plan for your consideration later this year or early next year. Thank you very much, and that concludes the presentation.
Thank you. Questions to the presentation? Councillor Joe Neal.
Yeah, my question through you, Mr. Chair, is to the consultant. What has your firm done in a concrete way to reduce or increase the diversion rate?
I'm sorry, I'm not sure.
Durham Region's diversion rate still stuck at about 63%. So is there anything that you've brought forth specifically to move that number?
Right, so we haven't actually started drafting the plan. We've really just been soliciting input on various aspects of the plan and developing these guiding principles, vision, and objectives that will guide it. So based on our experience and what the region has, already implemented and is considering, those would be the types of items that would be part of the draft plan when it's drafted this coming winter.
And are you familiar with for example, New York State implemented a plastic bag ban back in March. Do you know how much that's resulted in a reduction of tonnage in New York State by chance?
I do not know. I know that there are a number of jurisdictions, even here in Canada, where they have been implementing bag bans, particularly out in BC. I believe that.
I was asking specifically about New York State, ma'am.
Yeah, no, I don't know specifically about that one.
Thank you.
Thank you, Councillor Watt.
Thank you, Mr. Chair. And if I may direct my question to Mr. Anello, I just wondered, Mr. Anello, if you could please comment to the letter that we received from Wendy Bracken about adding the sixth guiding principle. It speaks to the toxic overload, and I note on the chart in the report it refers to body overload, but she is speaking to environment. Can you speak to why that wouldn't be considered as part of one of the guiding principles, as it seems to me that it is part of the action plans?
So thank you very much. So when we talk about toxic load in the environment, it's usually not a term that's used that way. There are toxic reductions. So when we look at the plans and the legislation in place, we have the chemical management plan, the registry for new products, and the Ontario plan for reduction of toxics, dealing with the reduction of the introduction of products and chemicals into the marketplace. Now, when we talk about our emissions and our releases to the environment, we send anything that we have to send to engineered landfills that do control any releases, and our emissions from our Durham Energy Center is basically in accordance with the limits prescribed by legislation. So when we discussed this at the committee and with Ms. Bracken, we basically indicated that toxic load is not a particular waste issue. It is controlled by manufacturing and by the introduction of new products. When we control the disposal of toxic waste, household hazardous waste, that's done through the waste management facilities, and that will be an extended producer responsibility transitioned over this July. So that particular aspect of toxic load will be taken over by the producers through the provincial government. So we couldn't think of where that would fit into our long-term plan here as far as objectives and targets.
So basically, in very simple terms, what you're suggesting, Mr. Anello, is that it's not a principle that could be adhered to by our organization.
That's correct. It's particularly the waste, yes.
Okay, thank you very much.
Thank you. Mayor Foster.
Mr. Chair, thank you. And I'm sorry, to the consultant, your name just disappeared off of my screen. Rourke, I think, Ms. Rourke. You were starting to answer a question on plastic bags and what's going on in Canada. I wonder if you would kindly finish what you had started to answer. Thank you.
Hi, thank you. Yeah, Christine Rourke. There are a number of jurisdictions within Canada that are either have or are considering implementing single-use plastic bag bans along with single-use items. I know the region has considered a number of these items and has reported to council on that. There's certainly things that we can take a look at as part of the development of the strategy to see kind of where they might be aligned with any legislation that might be coming and where the region's priorities are.
Okay, thank you. So when you do look at that, I know there are some legal issues out west. I'm not sure that I think there should have been some. And I think as well I've seen some information coming, mind you, from the Plastic Producers Association. So it may be a little biased, but there is suggestion that cotton bags are the least environmentally friendly. Will you be looking? Well, and it'd be nice to get some independent third-party advice on that, because sometimes we think we're doing a good thing when in fact we're not. Would you be giving us some good advice on that as well?
We can surely look at it. There's really no easy answer for any aspect of waste. And I know there is some literature about, the use of cotton bags versus different types of reusable bags, single use and paper. So we'll certainly look at the bag issue as part of the development of the plan.
On a broader view, we had a presentation at Clarington Council from the Diabetes Canada regarding collection of fibers. Their suggestion, it was a significant amount. I forget the percentage that they did. Will you be looking at that? So if their numbers are anywhere close, there's a huge amount of fiber that could be picked up at the curb or separated.
Absolutely. So textiles, I think, is probably the next sort of lowest hanging fruit for municipalities to look at. It's sort of a question of whether or not the municipality wants to deliver that program on their own or partner with a nonprofit agency. And then there's, various issues with for-profit or nonprofit and things like that. But certainly textile management would be something that we'd be looking at.
Wonderful. Thank you for your work. And Councillor Watton, thank you for asking the question you did. Mr. Chair, thank you.
Thank you. Members of council, that exhausts the chat box, so thank you for the presentation. Members of council, there was a meeting prior to this council meeting. I'm going to look for a 15-minute recess. Could I get a mover, please?
Move a recess, Mr. Chair.
Moved by Councillor
Seconded, Mulcahy.
Seconded by Councillor McKay. All those in favor of 15-minute recess?
Yes.
Aye.
Yes.
Yep.
Yes.
Aye.
In opposition? Hearing none, we'll come back into session around 11:16. Thank you. We're in recess. morning. I'll call this meeting back to order. Mr. Clerk, could you do a roll call, please?
Anderson. Anderson. Not present. Ash.
Present.
Barton.
Present.
Carter.
Yep, I'm here. Good morning.
Chapman. Chapman.
Yes.
Collier.
I'm here.
Crawford.
Present.
Dyes.
Present.
Drew.
Present.
Foster.
Present.
Hyatt.
Present.
Kerr.
Present.
Leahy.
Present.
Lee.
Present.
Mayor Pietri.
Present.
McLean.
Present.
Mitchell.
Present.
Mulcahy.
Present.
John Neal.
Present.
Joe Neal.
Here.
Nicholson.
Present.
Pickles.
Present.
Roy.
Here.
Ryan.
Present.
Schumer.
Here.
Smith.
Present.
Watton.
Present.
Yamada.
Here.
Chair Henry is present.
Thank you, Mr. Clerk. Item number 6, delegations. There are no delegations. Item number 7, there are no reports related to delegations. We'll move on to item 8. Item CC01 on page 53, correspondence from Mr. Bowlby, Director General of Census Management. Could I get someone to move the recommendation, please?
Smith removes.
Moved by Councilor
Seconded,
Smith.
Ryan.
Seconded by Mayor Ryan. On the item,
Very quickly, Mr. Chair, a question?
questions? Mayor Foster?
Yes, I haven't, and all of the mayors get, hundreds of bits of correspondence. I haven't seen that across my desk in Clarington. Should we be distributing that to the local municipalities to help advertise?
Yeah, so the clerk will take that as direction and we'll circulate it to the municipalities.
Thank you.
Okay. Any other questions? Councilor Anderson has just signed in, so he is here. Any other questions related to CC01? Hearing none, seeing none, I will call the vote. All those in favor?
Yes.
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 In opposition? Hearing none, that carries. We'll move on to committee reports. 9.1, we'll start there, which is finance. Sorry. Oh, sorry, just give me 1 second. Sorry, members of council. On the addendum, there are two other pieces of correspondence. Item CC02, correspondence from Ms. Wendy Bracken, Durham resident for long-term waste management. Could I get a recommendation to refer this to consideration of item 1 of the first report of Works Committee meeting, or Works Committee?
Earl Pickles.
Moved by
Drew.
Seconded by Councilor Drew. On the motion to refer, all those in favor?
Yes.
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 Yes. Yes.
Yes.
Aye.
Thank you. In opposition? Hearing none, that carries. Item CC03, correspondence from Carrie Madam, Curtis resident, long-term waste management plan 2020 consultation. Recommendation to refer consideration of item 1 of the report of Works Committee.
Refer.
Move it, Mr. Chair. Carter.
Mr. Chair, just have a declaration to make. I sent that in to clerks as well electronically regarding the long-term waste management portion that pertains to organic waste, as I have family members who reside in an area where an organic waste facility is currently being proposed.
So yes, Councilor Mayor Petty, the clerk has that. So item number
Thank you.
CC03 is moved by Mayor Carter, seconded by
Foster.
Mayor Foster. All those in favor?
Yes.
Yes.
Yes. Yes.
Aye.
Opposed? Hearing none, that carries. The members of council, there's two items that have popped up on my screen that are outside of the reports that are before us. I will not accept them. You need to pull those items at the report. Okay, moving on. Members of council, we will go on to committee reports. First report is Finance and Administration. Moved by Mayor Foster, seconded by Mayor Collier, that that the recommendations contained in items 1 to 4, inclusive of report number 1 of the Finance and Administration Committee, be adopted. Items to be pulled. Remember, members of council, we are on Finance and Administration. Items to be pulled. Seeing none and hearing none, we'll call the vote. All those in favor?
Yes.
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 Yes. Aye.
Yes. Yes. Yes.
In opposition?
Aye.
Hearing none, that carries. Members of council, we'll move on to the Works Committee meeting, or Works Committee. Just 1 second, please. Okay. Moved by Mayor Mitchell, seconded by Councilor Marion Pietri, that the recommendations contained in item 1 to 5, inclusive of report number 1 of the Works Committee, be adopted. Okay, members of council, polls. Okay, so give me 1 second.
Yeah, number 3 for me works.
Okay.
John.
So Councilor John Neal, item 2. Councilor Joe Neal, item 1 and 4. Okay, just checking the box. I also see, so Councilor, so the only item that has not been pulled is item 2. So we'll call the vote on the remainder, which would be item 2. All those in favor?
Aye.
Yes.
Aye.
Yes.
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 In opposition?
Mr. Chair, item 5. Oh, sorry.
Okay, sorry. There is no item 5. Oh, sorry. Oh, sorry. Yeah, so we have items 1, 3, 4, and 5. Okay. Okay. So that was, the vote was on the 1. The only one that wasn't carried or pulled was number 2, so we voted on that. And 5, okay. All right, so item number 1, Councillor Joe Neal.
Yeah, I'd move an amendment, Mr. Chair, that that a 6th guiding principle be added to set as a priority the reduction of toxic load on the environment.
Just a reminder, Councillor Neal, that'll have to be mailed in to us for the record. And you're looking for a seconder?
Yep.
Lost for the lack of
Crawford.
seconder. Oh,
Crawford will second.
okay, members of council. Okay, so now it's second. So the amendment, I just want to make sure that the clerk has captured it. It's to add a 6th guiding principle. Yes. Okay. Okay, Councillor Joe Neal, you have the floor.
Thanks, Mr. Chair. So this was a recommendation that was carried unanimously at the Waste Management or Energy from Waste Management Advisory Committee. So that would have included representatives from basically, I think, every municipality in Durham. So I didn't really follow the explanation given by Mr. Inello in response to the question from one of the councillors. Not sure why Durham would not want to endorse that as a guiding principle. And we hear, all the issues around toxic, emissions into the environment. Why would we not want to set as a priority the reduction of those? So thank you. Recorded vote. Thank you.
Mr. Clerk, at the appropriate time, a recorded vote. On item number 1, Mayor Mitchell.
Thank you, Mr. Chair. I believe Mr. Anello responded to this in his comments, but maybe the commissioner could reiterate. It's just not a practical item relating to waste management. It can be addressed by our long-term waste management plan, but I just asked the commissioner to speak to that if I could.
Okay, thank you. Ms. Siopis?
Thank you, Mr. Chair. Yes, Mr. Anello's comments will be similar to my own. First off, I think in terms of the broader topic, we do have the issue covered off under the objective that is before you today, that objective being protect or improve water, land, and air quality in Durham region. So in our objectives, we do address the subject in a broad way. And to be direct with you, I think addressing it in a broad way is the best course of action for the corporation. And that's because toxic loading, whether we're talking about the environment or on living organisms, it's a very broad topic, and it's certainly not central or focused to waste management activities. It's broader than that. It is touched upon also within our corporate strategic initiatives. So I do believe that's the place it belongs, although it's not something that would be ignored and in fact is outlined in our objectives here that are before you today. I hope that helps.
Mayor Mitchell?
No, I have no further comments, Mr. Chair. I won't be supporting the amendment.
Okay, thank you. Mayor Collier.
Thank you, Chair. Just a question through you to Ms. Siopis. I wonder, now I appreciate you saying that this is already covered off, but I wonder if you could just tell us, is there any negative thing to having this involved? I mean, it's just, again, setting a direction, and I'm a firm believer in, if we're going to have advisory committees that give us recommendations, we should probably give those, their due respect. So what would be the downside of having this sixth direction or guiding principle?
First off, with regard to, through the chair, sorry, with regard to direction and recommendations that come through the committee, we do our very best to assess every recommendation that comes through, and I believe we provided a memo to council that outlined how we responded to numerous issues that have come to us through the committee over the past year, including this one. And thank you for the opportunity to speak to it a little bit more specifically. Because it's a broader topic, we want the guiding principles for the long-term waste management plan to be the areas in which that plan can effectively impact the subject of each of the principles. The long-term waste plan, and in fact solid waste management, cannot have a large impact on toxic loading in either the environment or in living organisms. There's a lot of activities that happen, as I know you're aware, that are large contributors to toxic loading. Waste is one of those, and it's probably not nearly the largest. And in fact, as you know, for example, our EFW, it's closely monitored. Its emissions are well, probably some of the highest standards for any type of activity within Durham region, or I would go as far as Ontario and beyond. The emissions are very closely monitored, and the standards are very high. So it's a small aspect of what we're trying to achieve through the long-term waste management program and this plan going forward. And we want to focus on where we can make the most impact and have the biggest differences, make the biggest differences.
Okay, thank you for that. Just to make sure I'm understanding, I mean, from what you've said, it sounds like we're already doing this. So my question was, what would be the negative ramifications of having this in? Would it limit us in any way? If we're already doing it, again, I'm not understanding why this would matter.
Your question was, would it limit us? I think the way I would respond to that is to say to you, our focus needs to be on the areas where we need to make the most, where we can make the most impact. And those are specific to solid waste management activities. I don't want the focus of a guiding principle, a prominent guiding principle, to be something that we can have very little impact on.
Okay, thank you.
Thank you. Councillor Brian Nicholson.
Thank you, Mr. Chair. Respectfully, I have to disagree with the analysis given by staff. I do not believe that we have the highest standards possible for EFW. I do believe, however, it is our responsibility to clearly indicate to our residents that we believe that all steps that we take as a regional municipality, that anything we can do to reduce the toxic impact on the community, on flora and fauna, and on the human beings who live in our areas adjacent to our facilities, we should be making it very transparent. We should be making it very accountable, that it is in our guiding principles that limiting toxicity is one of our goals. I simply do not accept the premise that because it's hard, we shouldn't include it in the guiding principles. I believe it is our responsibility as elected officials to protect the health of our residents and our communities. And by having this toxic resolution included in the guiding principles, we are clearly stating out to our staff and to all future steps in this process that that will be one of the guiding principles that we will follow. As a number of councillors have indicated, I don't see the downside in this. It's a statement of intent. It's a statement of principles that we're going to make future decisions based on. And I really fail to understand why we would consider not voting for this particular addition. It is not harmful to the process. It may be a benefit in the long run. Our plans are not made for 2 weeks or 2 days, but they're made for a long-term analysis. And I think it just makes good common sense that this amendment be passed, and I urge members of council to support it. Thank you.
Thank you. In the chat box next is Councillor Joe Neal on an amendment to the amendment. Oh, sorry, I apologize. I'm going through all the first round speakers, and then I'll come back to you, Councillor Neal. Mayor Foster.
Well, thank you, Mr. Chair. Just a couple of comments. Firstly, there is no member of council, regardless of how they vote on this, that is going to agree that we should not limit the toxic load. So if this is being typified as a vote of, on individual councillors and worried about toxic load, we are all worried about toxic load. What we're hearing from staff is they're dealing with it. This is the wrong place to deal with it. So Ms. Siopis, to you, my understanding would be you would be concerned that on the long-term waste management and potentially the work that the committee does, that they might focus on toxic load when there are greater issues that they can have a far greater impact, that this might be a diversion. Am I hearing that properly?
Through the chair, yes, thank you, Mayor Foster. That is a concern of mine. I hope that where we're going to focus is where we are able to have benefit. And I'll give you some example if you don't mind. Right now, through our programs, we remove entire classes of toxins from the waste stream. We do that through the removal of household hazardous waste, removal of batteries, recycling paint, metals, plastics, you name it, electronics. And we also make a very significant effort to educate the residents about reducing waste and safely disposing of it. And all of those actions are clearly articulated in the vision and the guiding principles and through our objectives for the long-term waste management plan. This is not in any way being ignored. And in fact, our actions to date and going forward, it's a priority.
So I'm coming back to Mayor Collier's concern. So my initial reaction is it's not a big deal. I am concerned that a greater vision and objective, couldn't resist that, will in fact be, will be distracted. Can you bring back beyond what we are doing? I think what the question is here is, what should we be considering, beyond this? And this would include going to the government. So what stuff is made out of is problematic, in this. Can you come back, and this could be a motion at a later date, could you come back to us with suggestions as to what we do to advance this beyond what we're doing today?
Yes, Mr. Anello and I will look into that, and we would be happy to come back because, to your point, I think it's the more senior levels of government that actually have an impact when they put into places bans or limitations, and we've seen this in history through banning of things such as DDT and phosphates and pesticides. These are things that do have a very significant impact on toxic loading, and that's where the most impact comes from. So yes, we would be happy to come back with some suggestions for council on where we might be able to push in terms of the higher levels of government and through ourselves. Okay, and lastly, I heard you suggest that the emissions from the EFW are world class. I can't recall your exact. I heard another suggestion from a member of this council that they were not world class. Statements are important. Can you take it as direction to provide us backup, or again, if it needs to come as a report, but can we please get public information that either backs up your position or backs up the position that we have issues there? Absolutely.
Okay, thank you. Mr. Chair, thank you.
Thank you. Councillor Dice?
Thank you, Mr. Chair, and thank you to staff. I really appreciate your comments. However, this is a really important topic, and I know waste management in the future will be fluid, as will be the impacts of it. And we don't put enough value on the environment, and I mean a monetary value, because it is about our overall health, and that varies from person to person. I think we need to look at it from a different lens, that, in fact, that we do put a value on it, and that we look at it through a precautionary principle perspective. It's very important. If it's in the principle, then it can be reviewed. You may not have something that you can address at that moment as the review is taking place, but as the years go by, perhaps it will be very beneficial. And I think it really sends a very strong message to the public that we do value the environment here, and we will do whatever we can to protect it. So thank you.
That exhausts first round speakers in the chat box. Councillor Joe Neal, you have an amendment to the amendment?
Point of order, Mr. Chair. Since when do we go around more than once at a council meeting? A member gets to speak once and then we move on.
I get to reply, Mr. Chair.
Well, he's introducing an amendment, Councillor Chapman. An amendment to an amendment.
Yes, but we would have to vote on the amendment first, and then an amendment could be brought when we go back to the main motion.
That's not accurate, Mr. Chair.
Yeah, Councillor Chapman, he's amending an amendment that's already on the floor. Okay. Councillor Neal?
Yeah, thanks, Mr. Chair. I'm just trying to send my amendment to the amendment as well as the original amendment to the clerk. So if you just, will you just give me a minute while I do that, please?
Okay. Councillor Neal, we'll give you that time.
Thank you. Okay, that's been emailed to Mr. Walton, Mr. Chair.
1 second, please. Have you got it, Mr. Clerk? Okay, Councillor Neal, on your amendment to the amendment. Councillor Neal?
Can it be displayed on the screen, Mr. Chair? Because then it would be obvious to everybody what the amendment was.
Just give us a second, please.
Please. And I think I would take the prize as the councillor most in need of a haircut.
I think I have that prize.
No, I don't think so.
No, gentlemen, I have it.
No. Just if you look at this, I'm desperate for the barber shop to.
I vote for Tito. I vote for Tito.
Yeah, I wasn't going to say anything because I think it's a given there.
No, Tito's hair's looking good. Sorry.
Hey, members of council,
I don't feel sorry for anybody that needs a haircut. I'm sorry.
This is being web.
Me either, Ash.
I'm begging for hair.
You'll need a seconder. Yeah, we need to see it and then. Okay, members of council, it should be the amendment should be on your screen now. Your amendment to the amendment, Councillor Neal.
Yes, it'd be to strike the word reduction in the original amendment and replace it with the word limiting.
Okay, you will need a seconder on that.
Collier, second.
Seconded by Mayor Collier. Okay, Councillor Neal.
Yeah, thanks, Mr. Chair.
I can't see anything.
Councillor Neal.
Yeah, thank you. I think that coming out of the comments from staff, I think this is a compromise where, again, if the staff position is, well, we can't reduce toxic load if it's coming from other sources, but at the same time, what would be wrong with setting as a guiding principle the limiting of that? So, for instance, if we can, I don't think there's any question that if you're, for example, burning tens of thousands of tons of plastic, that is going to ultimately produce not only toxic load, but also probably carbon and so on that's being emitted into the atmosphere. But if we're going to try and eliminate plastic or come up with a different way of dealing with that, then that would be, I think, a sensible guiding principle that we're trying to do our best to limit that. And So I think that's a good compromise that hopefully all members of council can support, and I'll ask for a recorded vote on that. Thank you, sir.
Okay, thank you. Councillor Kerr, is your question to the amendment, or the amendment?
Thank you, Mr. Chair. Actually, it applies to both. I guess what my question to staff would be is, does either the amendment or now, especially the sub-amendment, restrict staff in any way from performing what are the established areas in which we already seem to reduce and limit the toxic load in the areas that we can actually do something about?
Sorry, Councillor Kerr, somebody has not got their computer on mute. Please continue.
Could staff hear that question all right, Mr. Chair?
I believe so. Ms. Siopis? Ms. Siopis, I think you might be on mute.
Mr. Chair, we lost connection just for a moment while Councillor Kerr was speaking. Could the comment be repeated, please?
Yes, Councillor Kerr.
Absolutely, Mr. Chair. And initially, the first part of my comment was, does this, first of all, the amendment, and secondly, the sub-amendment, restrict staff in any way from performing the duties and areas of responsibility in reducing what we can, the items that contribute to environmental toxicity?
Ms. Siopis?
Through the chair. And thank you. Through the chair. Two parts to that question. We do everything we can, obviously, and will continue to do, remove anything from the waste stream that we can. Our goal is absolutely to divert as much as we can. And that would apply to things that have high toxicity as well as other items that you know we're working to divert. When I look at the wording of the amendment in front of us, and I hope I'm not going too far by making this comment, there's two things that jump out at me. The way it is worded is talking about setting this as a priority, and for all of the comments I made earlier, I don't consider toxic loading. When you talk about our waste management to be a priority, because it is not an item that can have a large impact, a large positive impact. I do totally agree that we should be looking at everything we do, including everything in solid waste management, to remove toxins from the environment. But again, when we use the word priority, it puts a lot of emphasis on it. I also heard the comment, and I apologize up front if I'm speaking out of turn here. I heard the comment about, for example, the burning of plastic. That leads me to conversations in the future about what we do or don't do at the EFW. Mayor Foster had asked earlier for comment on our high standards in terms of emissions from the EFW, and we will absolutely do that in any case. But if this is a principle that is going to be applied constantly through the future weeks, months, and years with regard to what we do or don't burn at the EFW, we certainly need to look at the implications of that.
Okay, so that leads me to a second question. Does this amendment and now the sub-amendment open us up to having to necessarily delve into other areas that put toxic load on the environment that currently we do not have a mandate to do? And therefore, would that open us up to a requirement to take on added responsibilities or develop other things to suppress those, try to suppress those areas of toxic load source that currently we do not have a mandate to do?
And thank you for that question, Councillor Kerr. You've hit on a very important point, because the region doesn't create the materials that we receive in the waste stream. So we have negligible control over what the load is we receive. It's how we take care of it once we've received it. And like I said earlier, we remove entire classes of toxins from the waste stream through the diversion plans we already have in place. So yes, we are very limited.
burning plastics or other things at the EFW. Did I get that right?
Through the chair, that was an example that was used when one of the councillors was speaking. My point was we already have high emission standards at the EFW, so it's already covered off there. And the second point I was attempting to make was focusing where we can remove toxins from the waste stream and what we're already doing and hope to do going forward with this long-term waste management plan.
So my concern in what I thought I heard from you is if we do this policy, it might restrict what you do at the EFW or anywhere else. This is not all about the EFW. These conversations concern me to a degree because there is waste and ways of dealing with waste right across the region. But would this potentially have operational impacts? And where I'm going with this is if the operational impacts reduce toxic loading, and the word limiting is helpful, it's tough to argue with that.
So through the chair, I'm not certain about your question, Mayor Foster. I'm sorry about that. Am I concerned about it limiting how we operate the EFW? No, I'm not, because we live up to the standards and are required to live up to standards that have been set outside of the jurisdiction of this region. I am concerned that it will focus a lot of discussion around that, however, at the advisory committee level, as well as potentially at committee and council, on something that we do or don't have a whole lot of control over, whereas the long-term waste management plan is intended to take us forward in terms of actions that we have a lot of control over and hopefully can set direction with regard to waste management in the future here at the region. So for me, it has a lot to do with focus as well.
So I understand the focus, but I guess quickly, and Mr. Chair, I'm not going to belabor this. If we go to the plastics, and it's very discrete, and the EFW, which is discrete, and we need to broaden our horizons. We desperately need to broaden our horizons. If we go back to the plastics, would a principle like this potentially force you to look at other options rather than burning plastic at the EFW? I take your comments about controlling emissions, controlling what comes out, but in terms of controlling what goes in is what we're talking. So could that potentially lead to that?
I am presuming, through the chair, that it could lead to a lot of discussion around that, whereas it's not so much about what goes in as opposed to what comes out. That it is the most important thing that we need to be focusing on. And of course, the plan here, the plan in front of you, the long-term waste management plan, the whole objective is to reduce what we're sending to the EFW overall, regardless of levels of toxins.
Okay. Ms. Siopis, thank you ever so much. Mr. Chair, thank you.
So thank you. Councillor Ash, I don't think there's a need to call the question. This is the end of the chat box on the amendment to the amendment. So I will call, there was a recorded vote called on that, so I will call it now.
This is on changing the word reduction to limiting. Anderson?
Yes.
Ash?
No.
Barton?
No.
Carter?
No.
Chapman?
No.
Collier?
I like redundancy, yes.
Crawford?
Yes.
Dyes?
Yes.
Drew?
No.
Foster?
Yes.
Hyatt?
No.
Kerr?
No.
Leahy?
Yes.
Lee?
Yes.
Mayor Pietri?
I haven't gotten any advice on whether I can vote on this amendment, so I have to pass.
McLean?
No for McLean. No.
Mitchell?
No.
McCaughey?
No.
John Neal?
Yes.
Joe Neal?
Yes.
Nicholson?
Yes.
Pickles?
No.
Roy,
Yes.
Ryan,
No.
Schumer,
Yes.
Smith,
No.
Watton,
Yes.
Yamada,
Yes.
Chair Henry.
No.
It's a tough.
Loses on it.
Okay, members of
Chairman, it's 14-14.
members of council loses on a tie. Members of council, so we're now on the amendment. Seeing nothing in the chat box, I will call the vote on the amendment. It's a recorded vote.
Anderson,
No.
Leave the microwave while we're doing
Ash,
this. Pick up, please.
Mr. Chair, can you restate the question? Sorry.
Okay, so.
Yeah.
Sorry, members of council, somebody is not on mute. Okay, and the vote is on the original amendment.
Thank you.
I'm
Thank you.
definitely
My vote
hearing
is no.
something in the background. Could we please make sure you're on mute if you're not speaking?
Sorry, that was my granddaughter. I apologize. The vote is no.
Okay, thank you. Would you please continue, Mr. Clerk? We'll start again.
Anderson,
No.
Ash,
No.
Barton,
No.
Carter,
No.
Chapman,
No.
Collier,
Yes.
Crawford,
Yes.
Dyes,
Yes.
Drew,
No.
Foster,
No.
Hyatt,
No.
Kerr,
No.
Leahy,
No.
Lee.
Yes.
Councillor Mayor has a conflict of interest. McLean,
No.
Mitchell,
No.
Mulcahy,
No.
John Neal,
Yes.
Joe Neal.
Before I vote, Mr. Chair, can I ask for clarification on?
No, the vote is in process, Councillor Neal.
Well, I'm raising a point of order at this point, Mr. Chair.
In the middle of.
If maybe just allow me to ask it, but was Councillor Marion Pietri's vote, he had declared a conflict, was he counted as a no? Or?
He was not counted at all, Chairman.
Okay, thank you. Okay, thank you. Great. I vote yes. Thank you.
Nicholson,
Yes.
Pickles,
No.
Roy,
No.
Ryan,
No.
Schumer,
Yes.
Smith,
No.
Watton,
No.
Yamada,
No.
Chair Henry.
No. The amendment loses. We're on to the main motion. Seeing nothing in the chat box.
Do I still have the chair or the floor, Mr. Chair?
Pardon?
Councillor Neal, do I still have the floor because I put the amendment on the floor originally? So I think I still have the floor. I just wanted to follow up with a couple of comments.
Okay, go ahead, Councillor Neal.
Thank you. I guess I'm a bit at sea as far as the region's strategic plan. If this is part of the region's strategic plan, again, I'm just sort of circling back a little bit, I guess. But I'm a bit at sea as to why the region would not want to reinforce that in their long-term waste management plan. There are things such as toxins that are emitted by, just by driving around. So hopefully that'll still be looked at. But a lot of trucks driving around drives on diesel fuel and burning up thousands of gallons of diesel fuel. Is that not something that we could look at? How do we change that over the next 20 years? So although this toxic issue didn't make it into the the long-term guiding principles, I'm hearing that it's still nonetheless going to be a key priority. So I'll be watching that carefully. Thank you.
Thank you. Seeing no one else in the chat box, I will call the vote on the item. All those in favor?
Yes.
Aye.
Yes.
Yes.
Aye.
Yes.
Yes.
In opposition? Hearing none.
No.
Oh, that's one in opposition. That carries.
No.
Two in opposition. That still carries. Members.
No.
Okay, members of council. It carries. We'll move on to item number 3. Offer to renew lease with to the Durham Regional Police Services located in 19 Curtis Court. Councillor Joe Neal.
John.
Sorry, Councillor John Neal.
Yep, thanks, Mr. Chair. In regard to the renewal of this lease, and I have been talking about this for a long time, and I'm going to be consistent, but due to, and I talked about this at the Works Committee, due to my previous request for a police station in the North Oshawa, and I'm telling you right now, it was a request, but now with the emphasis on what's going on in regards to people moving out of Toronto into Oshawa directly, I'm not talking about surrounding areas of Oshawa, I'm talking directly in the North Oshawa, just in the Toronto Star when the mayor was talking about it. So I'd like to know, how do we go about leasing a compound for vehicles? Can we not do something in regards where there's a police station as well as a compound? I guess that would involve moving this location, but I'm wondering, due to the circumstances of what, and everything's changing so fast, are we now committed to something that we could exactly enhance? And I'm just running this by you, Mr. Chair. These are my comments because, I think that we're drastically in need of a police station North Oshawa with the amount of people that are coming in, and that's just within the last, I'd say, year, Mr. Chair. So that's why I'm not fully supporting this, and I'm questioning today as it was in Works. We don't have any police coverage or a footprint in North Oshawa. We have it on Center Street downtown. So that's my question. I'm just asking our staff, through you, Mr. Chair, is there a way that this could be accommodated? And I'm trying to be consistent in my request.
Okay. Ms. Siopis?
Thank you, Mr. Chair. This will be an indirect answer to the question because it's not a Works Department function to or decision to make about where a next police station might be located. I would point, though, to section 4.1 of our report, where it notes that although this lease is for 5 years, any time after the second year, with the provision of 6 months of notice, we can move from this premises. So if plans change, if they solidify in terms of another location, we do have the ability to move out of this lease.
So, for you, Mr. Chair, to Commissioner Skilbis, you're talking in 2 years? That's the option. We can move in 2 years?
So, yes, we have the right to terminate after 2 years as long as we provide 6 months notice.
So that's in 2023?
Correct.
Yeah. Well, that might be a little late, so I'm not fully in support of this kind of money to, I know we have to keep our vehicles somewhere, and it's just for vehicles, is it not?
I'm going to defer to Mr. Manuel to clarify, but I believe that storage area, office area, and garage area Mr. Manuel, are you able to add anything to the uses proposed on this site?
Yes, thank you, and through the chair. This site is currently housing the police quartermaster, canine, evidence, and property function. The intent is when the Clarington complex is finished, the phase 2 of that facility, the regional support center will house all of these functions. So we've renewed the lease for, we have a 5-year term where we have to keep this function housed, and we have the ability to terminate this lease as of December 31st, 2022, in order to coordinate with the construction of the regional support center.
And through you, Mr. Chair, to Ms. Emanuel, you said December 31st, 2022?
That's correct. That will be our time period where the 2-year term of the lease has expired, and after that 2-year term, we can provide notice.
Okay, those are my questions, but I'm a little bit, like I'm wondering, the way things are changing so fast that this is basically, it's not what we need in the north end of Oshawa, that's for sure, and it's a decade and a half of asking for something. Of course, I was promised a long time ago I'll be there by Chief McAlpine, but now it's a real, it's getting it down to the situation where we have the university as well, all that housing. It's nice to have growth, but at the same time, you have to keep up with growth. So I really don't see why we cannot do something different in that regard. So thank you very much.
Thank you. Mayor Collier.
Oh, thank you, Chair. I'd like to wade in on this conversation as the mayor of a municipality that's had 3 pretty intense shootings in the last 3 weeks. If we're putting out bids for police stations, I'd like to reiterate my request for one in Ajax that has been going on for Edmonton Regional Council for 15 years, only 11. But I was pushing for this well before I was on regional council as well. So if we're putting out our bids right now or our requests, I just want to refresh that one. Thank you, Chair.
Thank you. Councillor Chapman.
Thank you, Mr. Chair. Just a couple. I mean, the questions were answered. All this facility at 19 Curtis Court is going to be moved into the new complex that we have in Clarington with the police station, the forensic identification and all that. And it was always planned to do that. It's quartermaster stores, maintenance. But the other thing, just to reply to Councillor Neal, Councillor Chief McAlpine never promised a full police station in the north. At the time, we were building community police stations, community offices. If you remember the one down on Cedar Street, which is now used by victims, our Victim Services Division. And at the time, I was in charge of facilities for the police department, and the city of Oshawa couldn't come across with providing us. We were trying to get some space in the then Tribute Center, and it never materialized so that the two, both the city and the police, could come together on that. But there was never any intent to build a full-blown police station in North Oshawa. Whether it's needed now or not, I'll rely on the police statistics as they would normally go through their capital purchasing. Thank you.
Thank you.
Mr. Chair, Councillor John Neal.
Councillor Neal.
Actually, and I think it was 2003, Chief McAlpine stood up at Regional Council and he says, Councillor Neal, you are getting a police station in North Oshawa. He said that right in front of Regional Councillor. I don't think there's too many that were there that are left that when he announced that, but he did announce it at full council. So.
Okay, thank you. Seeing no other member of council in the chat box, I will call the vote on the item. All those in favor?
Aye.
Yes. Yes.
Yes. Yes.
In opposition?
Yes.
That carries. Members of council will move on to item 4, project update, additional engineering services for the proposed Whitby Water Supply Plant extension. Councillor Joe Neal.
Thanks, Mr. Chair. So through you to staff, this total number, $9,850,000, is that all engineering services?
Ms. Yopes.
Thank you, Mr. Chair. I will ask Mr. Presta to comment on what services are included in the total $9 million, please.
Through the chair, the approved total budget allowance for the 9 million is primarily engineering, investigations, approvals required for the project.
Okay, so it's not, there's no hard construction cost in that number, 9,850,000, is that correct?
Through the chair, that's correct.
Okay, so would an average charge out rate, say, be somewhere in the $200 to $250 range for these engineers?
Through the chair, the services that are required for the project can, depending on who's working on it and the qualifications, can range from $100 to $250 an hour.
Sorry, Mr. Chair, I'm having trouble hearing. There's a lot of noise in the background, but what was that number again, please? Was it 100 to 250?
Hello. Through the chair, can you hear me?
Yes, we can. Go ahead, please.
The range of fees are somewhere between $100 to $250 an hour.
Okay, so if we used an average, say just an average of $200 an hour, I'm coming up with 49,000 man hours, which seems an incredibly high number to me. Almost 50,000 man hours, or like 25 people working an entire year with doing nothing but working on this. I don't understand how it could take that much time. So, I realize these things are not simple, but at the same time, to say that we're going to have to hire 24 people for an outside engineering firm and have them work an entire year, nothing but one project, just to me is, these are unexplainable to me, but I guess you can explain anything, but I mean, they're eye-popping numbers just for engineering services. So, any comment?
Through the chair, this project is quite one of our largest projects that we're going to be constructed, and it's in the order of $150 to $160 million project. It does require a lot of time and resources to design.
So you feel that 49,000 hours is justifiable?
Through the chair, I would have to look at the exact number of hours, but there's a good effort that's required, approximately a couple of years to construct this project, to do design work on this project.
Okay, well, I'm sort of left scratching my head on this one, Mr. Chair. I just seems like such an incredible number of engineering hours, and that's not even the internal, I guess. This is all external, so I don't know how to deal with that other than to just comment on it, and I don't know how any firm could, for a project like that, say we're going to need 49,000 man hours to address this. So, recorded vote, please.
Thank you. Any other questions to the letter? Seeing none in the chat box, Mr. Clerk, a recorded vote has been called on item 4 by Councillor Joe Neal.
Anderson.
Yes.
Ash.
Yes.
Barton.
Please put your microphone on mute.
Barton.
Yes.
Carter.
Yes.
Chapman.
Yes.
Collier.
Yes.
Crawford.
Yes.
Dyes.
Yes.
Drew.
Yes.
Foster,
Yes.
Hyatt,
Yes.
Kerr,
Yes.
Leahy,
Yes.
Lee,
Yes.
Mayor Pietri,
Yes.
McLean,
Yes.
Mitchell,
Yes.
Mulcahy,
Yes.
John Neal,
Yes.
Joe Neal,
No.
Nicholson,
Yes.
Pickles,
Yes.
Roy,
Yes.
Ryan,
Yes.
Schumer,
Yes.
Smith,
Yes.
Watton,
Yes.
Yamada,
Yes.
Chair Henry.
Yes. That carries. Members of council will continue. We'll move on to item 5, confidential report of the Commissioner of Works. It was pulled by Mayor Foster. Mayor Foster, is it an open session question?
Sorry, Mr. Chair. I just noted that you had missed that when you said we were voting on only 2. So I'll simply move it. I have no concerns.
Okay, so we'll call the vote on 5. All those, sorry, 1 second, please. Okay, we're going to do the vote on 5 just to be safe. All those in favor?
Yes.
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 Yes. Yep.
Yes.
Aye.
Okay. In opposition? None, that carries. Members of council, if you would turn to page 62 in your agenda, the Committee of the Whole report, item 1, Toronto Global Update. Can I get a mover and a seconder to the report, please?
Pickles will move it.
Moved by Councillor Pickles,
Barton will second.
seconded by Mayor Barton. The item is now on the floor. Seeing nothing in the chat box and hearing nothing, I will call for the vote then. All those in favor?
Yes.
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 Aye.
Yes. Yes.
Aye.
Yep.
In opposition? Hearing none, that carries. That finishes the committee reports. Questions to committees, question to finance, Mayor Foster.
Thank you, Mr. Chair. Actually, the question was going to be to Ms. Siopis.
Oh, sorry, question. Go ahead.
Thank you. So, Ms. Siopis, there clearly we would be entirely insane, each and every one of us, to not worry about toxic loading. The suggestion from the committee and amendment, not a bad request, maybe just in the wrong spot. How would we better deal with that, or can you at least put some thought to how we would? So Councillor Dyes made a point that at least by doing this or something, we make a public statement. That's important. Mayor Collier, talked about redundancies, and redundancies are good. So how do we highlight what we are doing and what more we could be doing? And if you want to think about that, and perhaps I can talk to the Chair of Works, but do you have any knee-jerk reaction suggestions?
Thank you, and through the chair. Your earlier suggestion and request that we come back with some suggestions on a broader note with regard to toxic loading and other levels of government, we could combine your current request with regard to what we are doing here at the region, as it is both waste related and not so much related to waste, and could combine all of that into an information memo if that would be helpful.
Okay, thank you. And I'm going to guess that council is going to want to go beyond what we're doing now. Don't know that. But thank you for the response, Mr. Chair. Thank you.
Is there any other questions to staff? Seeing none, we'll move on. We'll go to next, section 10, notices of motion. If you could please turn to page 64 in your agenda. First notice of motion, COVID-19 resilience infrastructure investment in Canada infrastructure program, ICIP stream joint project partnership. Moved by Mayor Collier and seconded by Mayor Foster. Are you prepared to move with this item today, Mayor Collier and Mayor Foster?
I am, yes, Chair.
As am I. Thank you.
Okay. Could you please read it into the record, Mayor Collier?
Oh, boy. All right, just let me get to that page, please, Chair. 1 second.
Mayor Collier, don't start quite yet, please.
Can you give me the page number, please? Oh, I see it, 64. There we go. Thank you. Councillor Collier and Foster gave notice. The following motion will be presented at the January 27th
Collier,
meeting or subsequent
Mayor
meeting.
Collier, can you please hold for 1 minute, please?
Sure. Close the door, please, Michelle. Thank you.
Now, there's a little bit of confusion around this, Mayor Collier. I understand that there's possibly an amendment related to this.
Not to my knowledge.
Okay, then please continue.
Whereas the Ontario government on October 28th announced the launch of the Investing in Canada Infrastructure Program, ICIP, COVID-19 Resilience Infrastructure Local Government Stream to provide $250 million in infrastructure project support to municipalities across Ontario. And whereas the ICIP COVID-19 Local Government Stream allows municipalities to enter into partnerships for joint projects with other municipalities, nonprofit organizations, and other broader public sector organizations, with such projects requiring the endorsement of council through a municipal council resolution. And whereas the regional municipality of Durham is recommending the restoration of the Kingston Road and Salem Road Carruthers Creek wetland in partnership with the Toronto Regional Conservation Authority, TRCA, and the Town of Ajax as a joint project to be considered for funding under the ICIP COVID-19 Resilience Infrastructure Local Government Stream. And whereas the region of Durham has allocated $500,000 of its $4.8 million ICIP COVID-19 Resilience Infrastructure Local Government Stream funding towards this joint wetland restoration project, and the Town of Ajax has allocated $250,000 of its total $0.747 million ICIP COVID-19 Resilience Infrastructure Local Government Stream joint project. And whereas the wetland being restored is located in the Town of Ajax on land owned by the Town of Ajax and will improve habitat connectivity to the north and south along Carruthers Creek through approximately 2 hectares of wetland habitat restoration and 6 hectares of riparian habitat restoration. And whereas joint projects under the ICIP COVID-19 Resilience Infrastructure Program require the applicant municipality or one of its partners to attest to owning the asset put forward for funding. And whereas this joint project, along with the other 4 projects submitted for funding under the ICIP COVID-19 Resilience Infrastructure Local Government Stream, was detailed in Report 2020 Info 128, now therefore be resolved that the Council of the Regional Municipality of Durham endorse the joint ICIP COVID-19 Resilience Infrastructure Local Government Stream project application submitted by the Regional Municipality of Durham in joint partnership with the Toronto Regional Conservation Authority, TRCA, and the Town of Ajax for the restoration of the Kingston Road and Salem Road Carruthers Creek wetland located in and on land owned by the Town of Ajax at an estimated project cost of $750,000. And I'll just speak to it very quickly, please, Chair. Basically, this is a conformity exercise. This, I believe, has already been approved. It's just, this was, from my understanding, an oversight. I did not write this motion, but brought it forward on behalf of the municipality just to bring us into compliance with the funding requirements. And I'd ask for council support. Thank you, Chair.
Thank you. Is there any other member of council wishing to speak to this item? I'm just going to ask members of council just to give us 1 minute. Thank you.
I had a question, Mr. Chair.
Okay. Go ahead, Councillor Joe Neal.
Just specifically, I'm looking at the list of projects. They seem to be all focused on COVID issues, whereas this wetland doesn't seem to be COVID related, but thank you.
Okay, thank you. Councillor.
I guess I'm looking for a response, Mr. Chair, from somebody.
Okay, actually.
If I may, through the chair.
Yes, Sandra, please go ahead. Or is it Nancy?
It's Nancy Taylor speaking. This program was very, very complicated with respect to what was permitted within it. So it's entitled COVID, but one of the categories has to do with both disaster mitigation and adaptation, which is natural infrastructure flood mitigation, and another component relates to active transportation, which is the parks. So this one was, from an environmental perspective, quite important, and certainly Sandra Austin or Ian McVeigh might be able to speak to that more particularly, but that's why it fit into this category as a project.
Okay, thank you.
Councillor Pickles, we're on 10.1.
Yes, thank you. My question might be similar to that Councillor Neal had raised, but I had read that projects were selected based on their contribution towards pandemic mitigation and corporate strategic objectives. And I was just going to ask staff if they could comment as to how this project fit into that criteria, and whether staff were recommending this project be added to our, I guess we have a limit of 5 opposed to some other project that might more closely met the pandemic mitigation criteria. So it's similar to Councillor Hill, a little outside of the effects.
So, if I may, the report that was circulated to council was, just for your reference, it was a Receive for Information Report 2020-info-128, and it went in December because this submission had to take place by January 7th. So that report outlines the rationale and reasoning for the various projects that were included. So this one specifically speaks to wetland restoration within a watershed, supporting Durham's Community Climate Adaptation Plan. So that's why it came in as a priority from that perspective, and as well the partnership opportunities. So this one has partnered with Town of Ajax with their some of their allocation of resilience, as well as some discussion with Ducks Unlimited. It also has some potential. So because of the convergence of those opportunities, that would be sort of my high-level perspective. But again, certainly the CIO's office under the Climate Change Initiative may have some specific comments.
Yes, good afternoon. It's Sandra Austin. I'm happy to add additional comments through the chair. And thank you, Commissioner Taylor, for those comments. We truly viewed this as looking at wetland restoration projects because they have the highest value in terms of climate resilience when we're talking about urbanized areas. So areas that have high impermeable surfaces. So we did reach out to both TRCA and CLOCA, given that they cover these urbanized watersheds, in terms of looking at specific projects under climate resilience that would be able to best fit the parameters and the timing of the ICIP funding. So it's also important to recognize that there was a portion of the previous green stream funding that was reprofiled by the federal and provincial governments into ICIP. So they were looking for very similar projects.
Okay, well, that's very helpful. Thank you. It wasn't immediately clear how it met that criteria. I appreciate that. As these are as this is a notice of motion, I wanted to ensure that our CAO was supportive of the inclusion of this project. And maybe she doesn't need to answer again, but I think she said yes.
Yes, I'm supportive of all of the projects listed. Thank you.
Okay. Thank you.
Okay, members of council, I'm just going to ask for 1 minute, please. So, sorry, there's members of council. I'm just going to ask that there should be, and I'm hoping that I can get a mover on this, that if you were to look, that you would strike the application submitted by the regional municipality of Durham in joint partnership with the TRC and the town of Ajax, and replace that with the wording between the regional municipality of Durham, town of Ajax, and the TRCA.
I don't mind taking that as a friendly amendment, Chair.
Okay, so we've taken, Mr. Clerk, we can take that as a friendly? Okay, I will accept that as a friendly. Now to the item, members of council. I see no other member of council in the chat box. In that case, I will call the vote. All those in favor?
Yes.
Yes. Yes.
Aye.
Yes.
Yep.
Yes.
And in opposition? None, that carries. Members of council, if you would turn the page to page 65, item 10.2, support for recommended projects being considered under the COVID-19 Resilience Infrastructure Investing in Canada Infrastructure Program, also referred to as the ICIP stream. Mayor Foster, Mayor Collier, are you prepared to move on?
I am, sir.
Yes, Chair.
Okay, Mayor Foster, could you read it into the record, please?
I don't need to do this in one breath, do I?
No.
Here we go. Whereas the Ontario government on October 28, 2020 announced the launch of the Investing in Canada Infrastructure Program, ICIP COVID-19 Resilience Infrastructure Local Government Stream, to provide $250 million in infrastructure project support to municipalities across Ontario, with projects nominated under this program to start construction before September 30, 2021, and reach substantial completion by December 31, 2021. And whereas the region of municipality of Durham received a funding allocation of approximately $4.8 million and is limited to a maximum of 5 project submissions, including project bundles under this funding stream. And whereas the recommended projects were selected based on their contribution towards pandemic mitigation and corporate strategic objectives, as well as their ability to be completed within the project completion timeframe. And whereas the following list of projects and bundles were recommended for funding under the ICIP COVID-19 Resilience Infrastructure Local Government Stream, as detailed in report 2020 info-128. The program projects are 1, broadband Pickering Uxbridge fiber trunk, $2,825,970. TRCA wetland restoration, $500,000. Regional childcare playground replacements, $520,000. Childcare touchless retrofits, $18,200. Regional headquarters revolving door, $403,000. Regional Administration Building touchless retrofits, $147,975. Hybrid ambulances, $390,000. Healthcare clinic touchless retrofits, $26,550. And paramedic headquarters touchless features, $7,000, for a total of $4,838,695. Now, therefore, be it resolved that Council of the Regional Municipality of Durham endorse the 5 projects listed above for funding under the ICIP COVID-19 Resilience Infrastructure Local Government Stream, and authorize staff to engage in any necessary activity needed to complete the final project contribution agreements with the federal and provincial governments. And I'll make brief comments similar to Mayor Collier's comments. I take no credit whatsoever for having written this. And again, it does relate directly back to 2020 info-128. Thank you, Mr. Chair.
Okay, thank you. Question or comments? First on the list is Councillor John Neal, sorry.
Yeah, thanks, Mr. Chair. In regards to the top in the table, in the chart number 1 of 10.2, you have broadband Pickering Uxbridge fiber trunk, $2,825,000. That has that anything to do with the regional broadband network applications for provincial and federal funding, 2021-CLWG L2 on G specifically?
Okay, Oliver, CAO, respond.
Through you, Mr. Chair, no, it is not. In fact, this specific area in the broadband is not eligible for the funding application that was approved by Council.
No, and how would this, if this was to go through, would there be consistency across the whole north of Durham North, including the north part of Oshawa? Of course, I'm talking Raglan, Columbus, and I'm talking about Brock. Would that speed doing this? Would that speed access to Brock, Scugog, etc.?
I will ask Commissioner Bridgman to comment on that, but I will say that this is consistent with the region's long-term plan and vision for broadband. And if I could ask Commissioner Bridgman to talk about where this will improve service. Thank you.
Because it's all terrible out there anyway, so that's why I'm asking.
Mr. Bridgman?
Yes, it's Brian Bridgman here. I think the question was whether this Pickering to Uxbridge trunk is part of the broader broadband vision that the region has, and yes, it is. Certainly the interest and the desire of the region is to get all of the underserved and unserved areas covered, and we're doing it in as many ways as we can. As the CAO mentioned, this particular area was not eligible for the ICON and federal funding programs that are running right now, so we were able to take advantage of this other ISIP funding opportunity. So eventually, as best and as quickly as we can, the north, whether it be North Oshawa, North Uxbridge, Brock, whatever, we're doing everything we can as quickly as we can to get those areas served.
Okay, and also I'm not going to skip Whitby North because I know I just spoke to a resident out there on Myrtle Road, west of number 12, and they're spending enormous amounts of money just to try and work from home. And like I'm talking about very professional people, I appreciate what your concerns, how are you trying to address these concerns, Commissioner? But having said that, it's the same as the police station I was talking about earlier. Like everything's accelerating the needs and wants of the people because population now moving in to places like North Whitby, etc. So, I mean, I'm glad to see this addressed, but if this helps to speed up the rest of the municipalities, as well as what's referred to here as the Uxbridge, the Pickering Uxbridge trunk, that's fine and dandy. I thank you for your answer.
Very good, thank you.
Thank you. Mayor Carter.
First of all, good afternoon, Chairman. It's good to see you. I have to ask, the regional headquarters revolving door is $403,000. Can somebody give you the explanation on that, please?
Ms. Siopis?
Thank you, Mr. Chair. I will have to defer this question to Ms. DeManuel. She is more involved in that project. Jenny, please.
Thank you, and through the chair. The current design estimates we have are about $400,000. We're looking at installing a double door revolving door system at the front entrance. It's twofold. It's going to provide a separated ingress and egress, but it's also going to result in significant energy savings to the headquarters building. The current configuration of the double sliding doors allows for a lot of cold air to come in the summer. It permeates all the way up the elevator shaft to the upper levels of the building, and it will also assist with our cooling efforts in the summer.
So just a follow-up question, just because the cost is $403,000, is this the best utilization of a door in that particular location as a revolving door instead of traditional doors that may not cost $403,000? or is there a justification behind revolving doors that I might better understand?
If you're referring to the revolving door versus the existing sliding doors, there is a definite advantage to having the revolving doors, partially due to the energy savings. The west-facing entrance allows for a lot of the wind to blow in through the building. And the idea behind the revolving doors is that they will be automated, so they will move with the pace of the individuals walking through the turnstile. So that adds a little bit to the cost, but they will be touchless, so you're not actually pushing on the door. It will move with you in an automated way.
Okay, I appreciate it. Thank you.
Councillor Nicholson.
Thank you, Mr. Chair. Just have a question on procedure. The mover and seconder of these last two motions had indicated that they were not the authors of the motion. I wonder if someone could indicate to me who are the authors of this motion?
If I may, through the chair, it's Commissioner Taylor speaking. So we had submitted to the province the documentation on January 7th. Subject to Council's receiving the information report and the broadband report in December. And the ministry came back and said they wanted these specific resolutions because the first one was because it was a joint project, and then the second one was they wanted a specific council resolution as part of their request.
Can I assume from the timing of the provincial request that didn't allow it to go through the normal committee process or a committee of the whole process to come forward to this meeting?
That's correct. This program is incredibly challenging. Through the chair. This program is incredibly challenging because it didn't get announced till end of October, early November. It has, you have to have the project substantially complete by December 2021. You cannot do, there's issues with sole source, those kinds of things. You have to do both proper procurement. You can only do a maximum of 5 projects. You could only have one in each of 4 categories. So to be honest, it has been somewhat of a nightmare from a staff perspective to try to get projects that meet each of those deliverables that can be bundled into the maximum of 5 and that can actually be completed by December 31st. So we couldn't wait for another reporting cycle, nor could we get this done for the December reporting cycle, because trying to get these projects to fit into, we must have sent, 40 or 50 emails to the province trying to get them to interpret some of the projects we were trying to bundle. So that's why you see what you do today. It has been an incredibly challenging program.
Well, I thank you for that answer. It was the answer I was hoping to get, because I would be uncomfortable with going outside the committee deliberation and budgeting process without some due requirement from the province. So those are my questions, Mr. Chairman. Thank you very much.
Thank you. Councillor Kerr.
Yes, thank you, Chair Henry. Just to go back to this revolving door, was this, this is the price of a house for a lot of people. Was this put out to tender, or did this have to be a sole source contract?
Ms. Siopis?
Through the chair, I did hear Mr. Manuel say that this is all based on estimates at this point in time, and it would go through proper purchasing process. I will ask Mr. Manuel to elaborate if I've missed anything.
Thank you.
Thank you. And through the chair, we have not tendered this work yet. We are still completing design work. When we are ready to move to construction, we will tender this work. Bear in mind that there will be some work that has to be done on the building itself, so the cost of this work includes all of the modifications we'll have to make to the front entrance, as well as the equipment and the installation.
Okay, I think my price point question still stands. Is it just this door, or would we consider the energy savings and whether this to be to the other two entrances. I'm still thinking that's $400,000 is an awful lot for a set of doors. It is just the one entrance, is it?
That's correct. It's the west entrance of the building.
Okay. I guess I reserve comment for when the tenders come back. Thank you very much, Mr. Chair.
Thank you. Are there any other members of council wishing to speak to this item? Seeing none, I will call the vote on 10.2. All those in favor?
Yes.
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 In opposition? Hearing none, that carries. Members of council, we'll move on to item 11, which is unfinished business. There is no unfinished business. We'll move on to other business. Item 12.1, confidential memorandum from our CAO, Elaine Baxter Tahir, Chief Administrator Officer. Matters subject to informal, explicitly supplying confidence to the municipality or local board by Canada, province or territory or a crown agency. Members of council.
I'll move it go in camera, Chair.
Okay, can I ask that we move 12.1 to after 12.2 then? If I could get a motion. Oh, sorry. So maybe it might be easier to do this. Councillor Mayor Collier, on 12.2, we could move both items to go into closed session and deal with them both, one at a time.
I would prefer that, Chair. I have questions on both.
Okay, so moved by Mayor Collier, seconded by...
I second that, Councillor Anderson.
Councillor Anderson, that we move into closed session as per the rules that are posted within the items. One is, and 12.1 would be matters subject to information explicitly supplied in confidence to the municipality, and the 12.2 would be the information that was supplied from our Director of Legal Services, Jason Hunt, our regional solicitor, subject to receiving the advice, including communications necessary for the purpose. So the motion is to go into closed session. I will call the vote. All those in favor?
Yes.
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 In opposition? Hearing none, we will move into closed session. Members of council, just give us a couple minutes, please. Or just a couple minutes. Actually, 5. Should we take a recess, Mr. Clerk? Members of council, could I get a motion to take a 15-minute recess? Oh.
Yeah, Leahy, move it.
Foster, second.
Okay, moved by Councillor Leahy, and seconded by Councillor Foster that we take a 15-minute recess, and we'll call the vote. All those in favor?
Aye.
Yes. Yes.
Yes.
In opposition? Hearing none, we will see you back in 15 minutes.
Present.
Barton.
Present.
Carter.
Here.
Chapman.
Still here.
Collier.
I'm here.
Crawford.
Present.
Dyes.
Present.
Drew.
Present.
Foster.
Here.
Hyatt. Hyatt. Not present. Present. Kerr.
Present.
Okay, who do I need?
Would the members please mute if you're not speaking? Leahy.
Present.
Lee.
Here.
Marin Pietri.
Present.
McLean.
Present.
Mitchell.
Present.
Mulcahy.
Present.
John Neal.
Present.
Joe Neal.
Here.
Nicholson.
Present.
Pickles.
Present.
Roy.
I'm here.
Ryan. Ryan. Not present. Schumer.
Here.
Smith.
Present.
Watton.
Present.
Yamada. Yamada. Not present.
Sorry, here.
Present. Chair Henry is present.
Thank you. Members of council, we're on to item 12.1. Councillor McLean, you suggested you had a motion?
Yes, I do. Yes, I do, Mr. Chair. I have been communicating with staff with an outline of what I would like to put in this motion. I don't know whether staff has had a chance to review it, read it, or redact it, but if they haven't, I can...
Just give us 1 second, please. So the final version is just circulated, so bear with us for just a moment, please.
Thank you, Mr. Chair.
Mr. Chair, it's Councillor Ash. In the interim, do you want to do the bylaw?
No, we've only got a couple items left, Councillor Ash, and then it shouldn't hopefully not take too long. And then
Okay, no problem.
Thank you, though. So, members of council, it should be on your screen. Before you speak to this, Councillor McLean, you'll need a seconder.
Thank you. I believe Councillor Collier seconded that, or will second that, but...
Second, Chair.
Okay, thank you. The item is now before you. Go ahead, Councillor McLean.
Thank you, Your Worship, and I just want to give a little, Mr. Chair, I just want to give a little context to this motion. York Region is going to be experiencing growth. They're going to be experiencing like 153,000 new customers up in the Aurora area of their region. Over the past while, they've looked at an environmental assessment study to deal with this future growth in the northern part of York Region. And they spent about $100 million from what I understand. And through this process, they recommended a Lake Simcoe model for treatment of their sewage. And this treatment is state of the art from what I understand. From from the plant to the lake, it's drinking water quality. So that particular environment went through all kinds of studies with stakeholders, as well as First Nation people who agreed to this. It's my understanding, Mr. Chair, that for some reason, for some unknown reason, the province of Ontario has changed directions on this particular project, and they're now looking at Durham, so piping it from Aurora, from the 153,000 customers down to our treatment plant in Pickering. Without any explanation. So what this motion does, Mr. Chair, it requires that the province gives some type of explanation as to why they're doing this, why they're throwing out the baby with the bathwater on the York Simcoe project, and to give us some idea why, and the reasons behind it, and if they do decide to come to Pickering, how can we as a council or as a municipality speak out, speak up, or have some type of input into this? It's my understanding, Mr. Chair, that the province will just cross out a signature and this is a done deal. I also like to just ensure that this motion goes to our MPPs in Durham, as well as the Minister of the commenting ministers and the Premier and the opposition leaders, and the municipalities of Ajax and Pickering at least. And I'll call for a recorded vote, Mr. Chair.
Okay, thank you. Mayor Collier, you're in agreement to adding MPPs to the list and the Premier? And
Yes, Chair. Thank you.
And opposition leaders in area municipalities, correct?
Yes, Chair. Thank you.
Okay, I'll accept that as a.
And municipalities, and I'm sure Brock would like this.
Okay.
Ted?
Thank you. Okay. Next on the list, Councillor Joe Neal.
So, Mr. Chair, does this request that's being made in public run counter to any confidentiality obligations with the province?
I'll have our CEO respond.
No, it does not.
Councillor Neal?
Okay, thank you. Thank you.
Okay. Seeing no others in the chat box, a recorded vote was called. I'll call that vote now.
Anderson.
Yes.
Ash.
Yes.
Barton.
Yes.
Carter. Carter. Not present. Chapman.
Yes.
Collier.
Yes.
Crawford.
Yes.
Dyes.
Yes.
Drew.
Yes.
Foster.
Yes.
Hyatt.
Yes.
Kerr.
Yes.
Leahy.
Yes.
Lee.
Yes.
Marin Pietri. Marin Pietri. Not present. McLean.
Yes.
Mitchell.
Yes.
Mulcahy. Mulcahy.
Yes.
John Neal. John Neal.
Yes.
Joe Neal.
Yes.
Nicholson.
Yes.
Pickles.
Yes.
Roy.
Yes.
Ryan's absent on municipal business. Schumer.
Yes.
Smith.
Yes.
Watton.
Yes.
Yamada.
Yes.
Chair Henry.
Yes, that carries.
And Carter, also yes. My apologies.
Mayor Carter is also yes. Members of council, we'll move on to 12.2. Councillor Chapman, you suggested that you had a motion?
Actually, Chair, I had submitted a motion to the clerk through email as well. Collier.
Okay, well, I haven't received that to me yet, so Councillor Chapman is in the chat box, and I'll take him first.
Right, the clerk has my motion, if he could put it up.
Okay, thank you. Okay. Oh. Okay, just bear with us, members of council. Okay, members of council, Councillor Chapman's motion should be on your screen. Moved by Councillor Chapman, seconded by Mayor Carter.
That's all correct, Mr. Chair. I don't know if you want me to read it or you want me to just speak to it.
Yes, could you read it into the record, please?
Sure, that the confidential memorandum from Jason Hunt, Regional Solicitor, regarding the Beaverton Supportive Housing Project be received for information, and further, that proposals made to the Brock Township in an effort to resolve matters regarding the Beaverton Supportive Housing Project and the interim control bylaw be released publicly so that the residents of Brock Township may be aware of the concessions the region has offered to address the community concerns. And if I could speak to that, sir?
Yes, please.
Yeah, so got off to a rocky start with this project that the Council of Brock, with all due respect to them, was concerned about consultation. I think the region and regional council, we pushed this through given the COVID and the need that we have for this project. And that we already made some other motions that we've done. It's unfortunate that some of them haven't come to fruition, such as the community committee that we want that has been put on hold because of Brock's interim control bylaw. But we also had a motion that priority would be given to folks in the north for this supportive housing project. From some of the messages that I get, and I still receive emails from Brock residents about this with some concerns about this project, but there seems to be a lack of clear understanding of where we are with some of this. And I think some of it is because it's not being relayed. I understand that the Brock Township won't publish stuff on their website. That may be true or not now. I heard this a while ago of anything to do with this project. And of course, we have our website. So I think it's important that the residents of Brock know what we, the region, are doing to try to address the concerns that some of them have. And I think this is the way to do it, is make these items that are in this confidential matter open to the public, where they could be published on our website along with all the other information that is there about this supportive housing project. And I would ask for a recorded vote at the appropriate time, Mr. Chair. Thank you.
Thank you. Mayor Collier, on what came in, I'll have to come back to you on that when we're done this. Councillor Joe Neal.
Well, Mr. Chair, I don't think this is a well thought out strategy. I've been doing litigation type work now for too long, 36 years. And you never want to put a settlement position forth that's not without prejudice, that doesn't have settlement privilege attached to it, because it can be used against you if it isn't. So I don't know if I'm not giving anybody advice, especially Mr. Hunt, but anything you put out could be used by the other side in an affidavit. Do you really want that if it comes down to an application to quash the bylaw or some sort of court proceeding? If it's done as a public relations exercise, I think it's a mistake, because it's all those discussions that are taking place, if there are any, or positions put forth, should be done with privilege attached to it. So this could actually, the region could be shooting itself in the foot if it does this. So, but I think Mr. Hunt should be the one talking to that issue. But anyway, I don't support it to protect the region's interests. Thank you.
Okay. Thank you. Councillor Schumer.
Thank you, Mr. Chair. I'm just curious how this fits in with closed sessions on either side. We're obviously opening up what has been discussed in a closed session, and I guess maybe opening up what could have been possibly discussed at a closed session of Brock Council. So I guess just some input into that, if possible.
So I'll take that as a question, and I'll ask our CIO to respond.
Through you, Mr. Chair, we have put forth these concessions as privileged and confidential. We have not had any discussion or feedback from Brock Council. So at this time, we are essentially talking to ourselves, and we think it important that residents that have raised concerns with this project be aware of the lengths that the region has gone to and is prepared to go to address those concerns.
Councillor Schumer?
Yeah, I'm not sure if that really answers my question or concern. I just don't know where this could end up going out in the public. These are matters, like I said, discussed both sides in closed session, and we're opening it up. I mean, maybe I'm speaking to some of what Councillor Neal has already mentioned, but I guess if that's staff's mention that there's been no feedback from the township on it, if I can just, if I'm confirming that's the case, that we're comfortable with doing that, I guess that's the case.
Okay, thank you. Seeing no other person in the chat box, I will call the recorded vote, called by Councillor Chapman. Mr. Clerk?
Anderson. Anderson. Absent. Ash.
Yes.
Barton.
Yes.
Carter.
Yes.
Chapman.
Yes.
Collier.
Yes.
Crawford.
Yes.
Dyes.
Yes.
Drew.
Yes.
Foster. He is absent. Hyatt.
Yes.
Kerr.
Yes.
Leahy.
Yes.
Lee.
Yes.
Miriam Pietri.
He's had to step away.
Absent. McLean.
Yes.
Mitchell.
Yes.
Mulcahy.
Yes.
John Neal.
Yes.
Joe Neal.
No.
Nicholson.
Yes.
Pickles.
Yes.
Roy.
Yes.
Ryan is absent on municipal business. Schumer.
Yes.
Smith.
Yes.
Watton.
Yes.
Yamada.
Yes.
Chair Henry.
Yes, that carries. Mayor Collier, we got your note. It was after the process. We've already dealt with the item. May I suggest you bring that as a notice of motion?
Chair, it's quite timely, and I did submit it to the clerk quite some time ago.
I'm
I
sorry.
believe before Councilor McLean submitted his motion.
I'm sorry.
Or his amendment.
Whatever happened in the system, it just didn't get here in time for whatever reason. I'm giving you an option instead of having to go through and try to reopen this. It would take 2/3. I'm simply suggesting that you think about a notice of motion for the next council meeting.
I can put it as a notice of motion, Chair.
Okay, thank you.
I just further to that, I believe that I believe the timeline that we've been talking about could be the middle of February, and the council meeting comes after that, which would make the amendment redundant. I think I would rather ask for 2/3 to bring the amendment, Chair.
We have lost a number of members of council to municipal business already. We can try. It will take 2/3. You'll need a seconder.
As moved by myself, second.
Sorry.
Councilor McLean will second that. As opposed to amendment, can it not just be a separate motion? It'll cloud up the other motion, I think.
So in fairness, I haven't seen it, and it's only gone to the clerk, so I don't know what's in it. And that's why I was making another suggestion. So give me 1 minute, please.
Thank you.
Okay, so I'm going to, I haven't seen it, so I'm going to ask the clerk to display it.
And I do have some further wording to add to it, Chair.
The challenge is that just that this meeting has gone on longer, and I know that there was meetings booked, but regional business does come first. So Mayor Foster is now back, so.
Guess it's a good thing we didn't break for lunch.
We may very shortly, though.
I believe this will be rather quick. The wording I would like to just add.
Before you speak to it, allow me to read it. Yeah.
Mr. Chair, on a point of order, this goes against the current regional position. Wouldn't we have to rescind that position?
So just give me 1 minute.
On a different issue.
So members of council, please no chatting. And Councillor Ash, I did hear you. Allow me to read this, please. So, members of council, we don't need to reopen the item. What we need to do is do a motion to introduce this as a standalone motion. It will take 2/3. So I'm going to ask Mayor Collier, you'll first of all have to introduce a motion to waive the rules by two-thirds. It'll take two-thirds to add this item.
Thank you, Chair. Moved by myself, second by Councillor Lee, that we waive the rules procedure to introduce a notice of that motion.
Okay. So it takes two-thirds. If I hear any no's or more than 2 no's, I'll have to call for a recorded vote. So all those in favor of waiving the rules?
Yes.
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 Okay. In opposition?
No.
So we have 1 in opposition, so that carries, Mr. Clerk. Okay, Mayor Collier?
Thank you, Chair. And I did use some of the exact wording that was in the other report, but I feel it's important. I'll read it first. The council, and I do want to add the words to the end of this.
You need a seconder.
Oh, I'm sorry. I had put Councillor Dyes when I sent it to the clerk.
Okay, Councillor Dyes.
That's on the motion that I sent to the clerk, Councillor Dyes. I would just like to add the words to the end, also from the report that basically says, let me pull it up, that taxpayers and users in Durham must be protected from any financial implications of this decision. To the end of this motion, please.
Okay.
And that's from bullet 3.
Just give us 1 minute. And just to give me 1 second, it'll have to be a procedural issue. Okay, please continue.
The wording, taxpayers and users must be protected. Thank you. I'll just read it, Chair, that the Council of the Regional Municipality of Durham requests that if the Lake Ontario solution is selected in lieu of the Lake Simcoe option, that the Minister of the Environment, Conservation and Parks, MECP, order that all environmental benefits and conditions proposed for the Upper York sewer solution related to the Lake Simcoe option, including tertiary treatment, be required at the Duffins Water Pollution Control Plant, and that taxpayers and users in Durham must be protected from any financial implications of this decision. It's been a long day. I'll just speak to it very quickly. I asked all my questions prior, just that this is not anything that will be done by our decision. The region of Durham, the town of Ajax, and I believe on Monday, the city of Pickering have all passed resolutions in support of the Lake Simcoe option for the Upper York sewage solution and opposing the Lake Ontario position. At the same time, we know that Queen's Park is going to reconvene in about a month and a decision may be made contrary. I just want to, through this motion, make our position clear that if this decision is made, that Durham region not be saddled with both the costs and the potential environmental implications of that decision. The province has seen clear to order tertiary treatment on Lake Simcoe if the effluent from York is to go there. And I believe that the residents of Durham region deserve the exact same treatment on our waterfronts as well and should receive the exact same considerations. And I would ask for council support, please, and a recorded vote. Thank you.
Thank you. Councillor Nicholson.
Thank you, Mr. Chairman. I have sent to Mr. Walton an amendment to be inserted into the motion. I believe Mr. Walton may have it by now.
Yeah, yes, we have it.
If I could just move an amendment. I think it's friendly, but that's the council to decide. That we add after the word "that" in the first line, that notwithstanding the current regional council position in support of the Lake Simcoe option, comma, and then the continuing.
I'll accept that as friendly, Chair.
Yeah, I just wanted to make sure that the province knows that this motion isn't changing our position. We still support the Lake Simcoe option.
Correct. Thank you.
Okay, thank you. Councillor McLean.
Thank you, Mr. Chair, and I will be supporting this. I think it's a very important motion and it doesn't muddy up the previous one, so I'm glad it's different on its own. And I realize that the Minister of Environment and Parks ordered that all environmental benefits and conditions proposed to York include Durham region. The one thing I'm just going to ask if I can do a friendly amendment to include also the First Nations of our area. Because they included the First Nations up in York, which is a different branch from what I understand. And I think they should also include the First Nations down here for commenting. So could I have that as a friendly amendment or?
Just 1 second, please.
And I would put that in, I would put that in there somewhere after benefits and conditions proposed, as well as consultation with the First Nations. Somewhere in there.
I would consider that friendly, Chair, and we may as well also add that the distribution to the MPs, MPPs, and the usual distribution list as well.
Thank you, Sean. I think it's First Nation. I think it's the Mississaugas. I could be wrong. First Nations is good.
Thank you, Mayor Mitchell.
Thank you, Mr. Chair. Just a question on this. Commissioner Siopis and Mr. Presta, but I just had an understanding that the energy costs, operating costs of tertiary were significantly higher than current practice, and I wonder if they have any information on that.
Ms. Siopis? Or...
Mr. Chair, if I may ask Mr. Presta to respond, please.
Okay, Mr. Presta?
Through the chair, yes, operating costs for tertiary treatment are substantially more. There's a substantial amount more energy required in the treatment process.
So can you give us any sense of what substantial means? Twice as much, 3 times as much, 10 times as much?
Through the chair again, I'm only guesstimating at this time. I don't have that right in front of me. For probably, double, I would say in the order of double the amount of energy required. And in terms of greenhouse gas emissions, it would be substantially more.
Okay, and sorry, because this question, this is a big motion to come on at this time of day, if you will, but in terms of the dollars that double means, do you have any ballpark sense of that?
Well, if through the chair again, if we're spending in the order of $8 to $9 million on energy, that means that you would double that number in the order of $18 million. And the capital costs have also been documented before. They're in the order of 250 to 300 million.
I believe this is addressed under point of order that the taxpayer and users in Durham must be protected, that York would pay for these costs, is what the motion is saying. If they're going to trigger the expansion, they pay for the cost. That's the intent.
So point of order is on procedural issues. So Mayor Mitchell, would you please continue?
Yeah, thank you, Mr. Chair. So actually, Mayor Collier, I support your resolution. Again, I think it should be really spelled out that if you're capturing costs, they are not only capital costs, but future energy operating costs, because I expect Mr. Presta is significantly underestimating the added energy costs. So that should be very clear that additional long-term cost needs to also be recovered by the province on a permanent basis and not by regional taxpayers. Those are my comments, Mr. Chair, but I think it should be a little clearer that it is all future additional operating costs.
Okay. Thank you. Yes, sorry, Councillor Ash, I did miss you. Councillor Ash?
Thank you, Your Chair. Thank you, Mr. Chair. It's been a long day. I want to move a motion to refer this back to staff. Councillor Mitchell adds some excellent points. We're talking about a 10 million, tens of millions of dollars, and despite the Tooth Fairy and Easter Bunny clause included in the last one, the taxpayers must be protected from any financial implications.
You're not supposed to speak to the referral. The referral is to refer this
sorry,
back to.
The referral is to send it back to staff for calculation on the added cost, notwithstanding the inclusion of the taxpayer exclusion clause. That's in the current motion. So I'd like to refer back to get a written response from staff.
Yes, and that would go to Works Committee. Councillor Ash, and you'll need
that would be fine with me.
There needs to be a seconder.
I would second that.
Who was that? Councillor Mitchell or Mayor Mitchell? Thank you. Okay, the referral is now on the floor. All those in favor of the referral?
Yes.
Aye.
Yes.
Aye. Aye.
Yes.
Record a vote, please, Chair.
Record a vote on the referral.
Yes.
It's too late. Already read it.
Anderson.
Yes.
Ash.
Yes.
Barton.
Yes.
Carter.
Yes.
Chapman.
Yes.
Collier.
No.
Crawford.
No.
Dyes.
No.
Drew.
Yes.
Foster.
Yes.
Hyatt.
Yes.
Kerr.
Yes.
Leahy.
Yes.
Lee.
No.
Sorry.
No.
Maren Pietri. Absent. McLean.
No.
Mitchell.
Yes.
Mulcahy.
Yes.
John Neal.
Yes.
Joe Neal.
No.
Nicholson.
No.
Pickles.
Yes.
Roy.
Yes. Yes.
Ryan is absent on municipal business. Schumer. Schumer. Absent. Smith.
Yes.
Watt.
Sorry, yes, Councillor Schumer is voting yes. Couldn't get my mic on.
Watton.
Yes.
Yamada.
No.
Chair Henry.
Yes, that carries. Members of council, we'll move on to announcements. Seeing none in the chat box or hearing none, we'll move on.
I have one, Mr. Chair.
Go ahead.
Sorry, I was trying to get it written in. It's Councillor Chapman.
Go ahead, Councillor Chapman.
Just to advise that this year, virtually in Oshawa, the Refuge is still running the Coldest Night of the Year event with the different teams or different members doing their own 2, 5, or 10K block. and that donations are open. If anybody wants to make a donation to, don't be surprised, you out-of-towners, that my team name is Oshawa Strong. But if anybody wants to make a donation to me or my team for doing this, if you go on CNOY 2021 and you look for either my name or my team, I would very much appreciate it. And I thank you, Mr. Chair, for the donation that you made.
You're absolutely welcome. And the cause is? Councillor
Oh, I'm sorry. It's to support the refuge, which is youth at risk, and all the supports that they provide those at their facility here in Oshawa.
Okay, thank you. Any other announcements? Seeing none and hearing none, Councillor Ash.
Thank you, Mr. Chair. It's moved by myself and seconded by Councillor Lee that bylaw number 01-2021 be passed.
Okay, moved and seconded. Questions? Seeing none and hearing none, I'll call the vote. All those in favor?
Yes.
Aye.
Yes.
Yes.
Aye.
Yes.
Opposed? None, that carries. Councillor Ash?
Mr. Chair, it's my pleasure to introduce the confirming bylaw. It's moved by myself and also seconded by Councillor Lee that bylaw number 02-2021 be a bylaw to confirm the proceedings of the Council of the Regional Municipality of Durham at their meeting held virtually on the 27th day of January 2020 be passed.
Let's call the vote. All those in favor?
21.
Aye.
Aye.
In opposition? Hearing none, that carries. Members of council, I'm looking for someone to move adjournment.
Motion to adjourn.
Moved by seconded by Councillor, was that
Kerr.
Councillor Kerr?
Recorded vote, please.
Seconded by Councillor Kerr. All those in favor of adjournment?
Yes.
Yes.
Aye.
Opposed?
Thank you, Mr. Chair.
Thank you. Opposed? None, that carries. We are adjourned. Stay safe, wear your mask, wash your hands, and don't go out unless you're going grocery shopping and go by yourself. Stay safe.
Thank you, Mr. Chair.
Thank you.